Good afternoon, ladies and gentlemen. Welcome you to the Seoul Design International Forum 2020. I am greeting you today, followed by yesterday's session as well. Nice to meet you. Seoul Metropolitan strives to implement the universal design to create a better city. We have discussed about universal design yesterday, and today we're going to talk about the design for social resilience in the post-COVID-19 through this Seoul Design International Forum 2020. Due to COVID-19, we are conducting this forum via online, and I am very grateful that so many of you have joined us, likewise since yesterday. We have a lot of participants today as well. Can you please wave your hand, show of your hands to show welcome? I hope you will be able to stay with us throughout the sessions. By doing so, you will be able to receive insights, and it will be a very valuable meeting for you. Today, we're discussed about the universal designs regarding post-COVID-19, and today we are going to look at the design for social resilience in the post-COVID-19. I believe that 180% degrees change has occurred in the way that we look at the designs. So these issues that we face nowadays, we need to come up with different kinds of solutions. We need to use our creation. And amid that, I believe the role of design has become a greater importance to that. We have invited various speakers from home and abroad to listen to their opinions and their stories. And based on that, we'll be able to hear the social problem-solving design policy and vision of Seoul Metropolitan Government. Now I would like to begin the second day of Seoul Design International Forum 2020. Likewise, as of yesterday, of day one, we're going to have 4 different sessions today. We're going to listen to the speakers' stories during the 3 sessions, and lastly, during the session 4, we're going to have a panel discussion with the local speakers, invite them to on stage. Now we're going to start the session 1 regarding social problems, solving design policy and vision for post-COVID-19. I would like to invite Gerald Vladenberg, Director of Design at IBM, on the keynote speech of the process and outcomes of the COVID-19 Design Challenge.
My name's Carl Vredenberg, and I'm the Director of IBM's Global Design Leadership and Academic Programs. And I'm here today to talk about the process and outcomes of the COVID-19 Design Challenge that some colleagues and myself ran some numbers of months. Hi, my name's Carl Vredenberg, and I'm the Director of IBM's Global Design Leadership and Academic Programs. And I'm here today to talk about the process and outcomes of the COVID-19 Design Challenge that some colleagues and myself ran some numbers of months ago. So let's start with where this idea came from. So I presented the keynote address at the Design for America Summit and Conference in Chicago last year, and also wrote a blog post about it at carlvredenberg.com as well. And I was really expressing the view that I've had for a long time, which is really that designers should do more than just do the work for which they're being paid for the companies that they work for. I really thought that designers could use their power of the methods of design to really make a huge impact on addressing sort of the major challenges of the world. So I made a challenge to designers at that conference to be bold, global, and personal in taking on, major challenges over and above the work that they do, that they get paid for. And what was interesting was just a few months after that talk, there was a major change in the world. We had the biggest challenge of our lifetimes, and that is the introduction of the COVID-19 pandemic, which was huge, affected all parts of the world. And we felt that it was time for designers to rise to the challenge and use their skills to try to address some aspects of that challenge. So I got together with the president of the World Design Organization, Srinivasan, as well as his board of governors, and also got together with Rebecca Brower and Liz Gerber of the Design for America organization, and then together with Tracy Nguyen of the IBM Service Corps and Corporate Social Responsibility, we basically got together our 3 organizations and started to think about how we could collectively start to make a difference to this challenge. So where did we start? We started by basically launching this effort by reaching out to the designers each of our communities. And we asked them to propose COVID-19 challenges that they thought designers could have an impact on in addressing the overall problem. So we came up with some 180 plus challenge statements, and we put those all on little sticky notes, and we then clustered them into themes that were related to one another, and then we gave them names, and then collectively we voted on 2 attributes of each of these clusters of challenges. We wanted to vote for challenges that had impact, where we wanted to know if we were to address that challenge, what kind of impact would it have on addressing that problem, and also the urgency. How necessary was it to address that challenge really, really soon. So after we did all those ratings and voting, we came up with what we call a prioritization grid of impact by urgency. And things that are high on impact and high on urgency also floated to the top right of this prioritization grid, which also meant they were the ones that were the most impactful and the most urgent. And so we came up with some 7 topics that were key, that were both highly impactful and urgent. And those 7 were these themes. So we're talking about how could we as designers have an impact on designing the communication that could make people adopt safe behaviors and thereby try to reduce the infection rate. We also wanted to work on issues with regard to helping hospitals and intensive care units in hospitals that were being overrun and needed to have staff coming into them, help them with their training and be able to rapidly get people up to speed on effectively working in those environments. We also wanted to address vulnerable populations, people that had health concerns, that were older, that etc. And then we also wanted to look at the personal protective equipment, or PPE. How could we make that more readily available? And then also we realized that education was now pivoting from being in person to being digital. So we wanted to, where we could, reinvent the approach to education and making it really optimal and doing it remotely. And then lastly, we also wanted to realize that a lot of people were losing their jobs due to COVID-19 and its lockdowns. What could we do to help those people as well? So those 7 areas were they then given to teams from around the world. We basically had a team in each of 3 regions working on those challenges. So 21 teams in total, for a total of about 350 people working on each of these challenges remotely, all from their homes in 17 time zones. Quite the challenge. And the regions were the Americas, Europe and Africa, and then Asia Pacific. Now, how did we do this work? Well, we did it because we're all remote using some technology. So we use Zoom as well as WebEx for our meetings and get-togethers. We use Slack for our asynchronous communication. And we also use Mural as our digital whiteboard, if you will, with regard to what we would normally do in person, with regard to Post-it notes and Sharpies on whiteboard walls when we're doing workshopping for design thinking, for example. This time we used a digital equivalent, and that is the Mural tool. So we had leads that understood design thinking properly, lead these teams. Those were largely from IBM and the Design for America, as well as some from World Design Organization. We scheduled daily team calls. We included our leadership team in that as well. We had a leadership team from each of the 3 organizations. And we gave assignments during each of those calls, had check-in calls to really support the leaders of each of these working groups, and used Slack to communicate asynchronously between each of those meetings. And then we held 2 what we call playbacks, basically the status of where those projects were at, and sharing that with everyone from all these teams together. And then after that, we identified what I call the catchers, who's now going to carry on this particular activity after we've come up with these ideas. It might be a handoff completely to another organization. It may also be something that the team wanted to continue on with, and we had both of those instances. And then we also built a website to be able to share this information as well, which I'll be telling you about in a little while. And I've mentioned using design thinking. Well, we've used the IBM enterprise design thinking overall approach that has these 3 principles, this concept of a loop, and then also the keys. So the principles really are to focus on user outcomes is a fundamental focus. And then the concept of restless reinvention, that we constantly keep on iterating, and that we wanted to have diverse, empowered teams, and that's what we had across the globe. And interestingly, they're diverse in the sense that we had people that were, deans of design schools through to students at those design schools. We also had heads of design agencies. We had people from IBM in all parts of the company that worked in IBM as well. We had a really, really wide range, and that was actually the diversity of that, both in the types, the ages, the level of experience, but also the global reach. We had people from all over the globe working on these problems. That was really, really important. Then we had the concept of the loop, which is basically starting with really observing and understanding a problem deeply, then reflecting on what insights we gleaned from doing that, and then starting to prototype quickly, as well. And then we have the notion of the keys. We have this concept of hills, which is basically a statement of who is going to be able to do what with what wow experience. We created some of those. We also did playbacks on a regular basis, which is talking about the solution from the point of view of the user. And then we also included sponsor users. We had people that were representative of the people that we were trying to influence or trying to have an impact on improving their lives be part of this effort as well. And I show the little badge there, the coach badge, because that was the badge that we had the people that were leading these teams knew enterprise design thinking to the level of being a coach, which is a fairly high level of knowledge. And that really was part of the factor that really influenced the success of this overall effort as well. Now, if you want to learn more about enterprise design thinking, you can go to ibm.com/design/thinking, and you can there get free education and actually earn badges like this one. You start off with what's called the practitioner badge, but you can learn these methods yourself and actually then use those methods to address challenges much like the ones we're talking about here. But let's work a little bit through what that actually looked like as we did that work. So we basically kicked off the project, and then we used this tool that I talked about earlier, the mural, to be able to collaboratively work on a digital whiteboard where we would be able to simultaneously be putting Post-its and dots and writing and anything we wanted to on the shared space. So each one of those 21 teams had one of these mural boards that look like the three sort of examples that I show up here. So they work from the left all the way around to the bottom of the bottom right. And so we started off by understanding deeply who it is that's involved in or who's being targeted to address with regard to the how might we statement that we're working on. So if we're working on improving and encouraging people to use safe behaviors, we would understand more deeply what, for example, a young person's perspective was, what a woman in India's perspective might be, et cetera, et cetera. So each of those personas that we decided to focus on, we actually did what's called an empathy map and actually understood them from the point of view of what do they do, what do they say, what do they think, and very importantly, what do they feel. So we would get a deep understanding of who it is that this was going to be targeted at, so that when we came up with solutions, we'd actually be able to address them to the particular person that we were designing for. We also then did an as-is scenario map, which is basically what is going on today with regard to that challenge we're trying to address, and to identify specific areas that are most in need of being addressed. After that, we identified what might be the best ideas to address those problems that we identified in an ideation exercise. And we have a variety of ways of being very creative in coming up with ideas. And then all the team members would share those ideas with one another. And then they would vote, much like we did when we're doing the challenge statements, to identify what were the most impactful ideas that people came up with, as well as ones that were the most practical or urgent to be able to address as well. And then the ideas that were the most both impactful as well as practical and urgent, we came up with those and determined that those are the ones that we needed to actually develop a solution for. So we would create what we called a basically a scenario or a we basically mapped out basically the steps that would be required in a storyboard to be able to tell the story of what that future solution might be like for the actual user. We'd come out with a hill statement. What would that end result look like with regard to that user? What would be their their experience after this thing was actually developed and put into their hands? What change would it actually affect? And essentially, who would be able to do what differently, and what wow experience would they have? And then after that, we actually just did some prototyping, basically built some of the things that we talked about, and then gathered feedback on those and iterated on those and improved them as well. This was all done in a matter of a few weeks. And we also did 2 playbacks with the whole rest of the team so that they could get additional feedback on those ideas as well. I should mention that we also wanted to freely share the information that we're coming up with to have the biggest impact on the world. And so we decided to take a very open approach to our intellectual property that we created, and made sure that everybody agreed to adopt basically Creative Commons licensing as well as open source licensing if it were software that we were building. We wanted to make sure that anything we came up with would be able to be freely used. So what did we do to share these materials after we came up with these ideas? We created a website that you can go to called the COVID-19 designchallenge.org that has all of the projects that we developed, as well as giving you opportunities to become part of those projects, because some of them are still going on. Other ones you can just download and use. We also reference these materials and that website on the World Design Organization.org website, the designforamerica.com website, and the IBM.com website as well, just to get a lot of attention on this as well. I wrote also an article basically on Medium about this overall challenge as well. So let's go into some of the examples of what came out of doing this very work with some really talented designers from around the world. So when we talked about changing behaviors, here's some examples of things that we've come up with that were provided for Facebook, for Twitter, for Instagram, and the like, just so people could share this with their friends. And we focused on, for example, how does a younger person get motivated to wear masks? Well, we gave this image of, and this phrase, "Dad, I picked up something for you when I went out." And this is this notion of, a parent, for example, now being in the hospital, trying to really hit home hard what might be the result and consequence of not doing these behaviors appropriately. Also the focus on the top right of protecting those who can't protect themselves in terms of more elderly people as well. Tried to also make wearing masks and behaviors like doing the behaviors correctly as being something that would make you a hero, make it a really positive thing for people to do. So that was one other theme that we went with. We also took some examples of working through scenarios that involved games or interesting ways to get people's attention, as well as making the case that masks are fashionable and you could make a fashion statement wearing these. And also very importantly, again, really enforcing and really trying to incite and interest people in staying home. We also wanted to thank the people that were the frontline workers, the people that still needed to go to work and were somewhat risking their lives doing that, and wanted to thank them for that. Also a real theme on, while we're physically distancing, you still need to socially distanced in the sense that you still should stay in touch, to older members of your family, for example, in the examples that we show here, and also some interesting acute ways to try to reinforce things like the physical distancing that we wanted to encourage. In addition to that sort of information campaign, we also looked at a whole variety of, apps and websites and physical items as well. So everything from trying to understand better what the experience of certain people in your region was in terms of experiences with COVID-19, to the notion of even getting a help with a map to be able to avoid places that had a lot of people in them, for example. Also even a social distancing belt to be able to actually see what 2 meters look like in terms of trying to keep that kind of a distance from people. Actually getting into WhatsApp and other social media areas of providing emojis. So that would also encourage things like mask wearing. And then also a bunch of other stickers to be able to put on physical things to be able to encourage these good behaviors as well. We also had the notion of being able to say thank you, to put stickers, for example, on delivery bags of food and the like. Also this notion of saying thank you to the key people in your life that you wanted to thank, and also a focus on an application for the delivery of and the optimization using AI of personal protective equipment as well. A really wide range of solutions. And there's even more than that, but you can go to that website that I told you about to even find out the whole list of examples of projects. And I wanted to just share with you, if you're thinking about doing this kind of thing yourself for these kinds of challenges, what kind of lessons we learned in running this particular design challenge. The first was that really big and urgent projects, doing it with a whole lot of people requires just-in-time planning. We needed to use a word that startups use a lot, pivot. We needed to regularly, as a leadership team, think, oh, now we have this, now we need to go change the perspective, on this as well, and need to change something about the way that we were working. Also, this notion that, not to boil the ocean, for example, of working on absolutely everything. That's one thing, a thing we really did do well here, and really focusing on only the most urgent and impactful right now. A lot of the time you look at a problem, you realize there's just so many aspects to it that you can't do all of them at the same time. And some of the time that leads people to not being able to start. Well, I think you can start, and you can use these kinds of methods to determine which kinds of things within the challenges that you are experiencing are going to be the most urgent and impactful to focus on, and then also to develop those as well. Working with, many organizations, in our case, the 3 organizations together, but then, hundreds of people around the globe that are all very different and all working from home, required constant communication. So the leaders that worked here together, largely Srini, Rebecca, and I spent the most time together of really coordinating everything that we were doing here. And that required, almost daily communication. Also, if you involve the world, we had 17 time zones involved in this project, right? It was involved a real challenge of the fact that you needed to make sure that you were working around the globe. And that was actually around the clock. That was actually really a benefit that we really realized, that one team could be working overnight basically from another team and be able to actually leverage that information as well. So we had teams doing user research, actually understanding, doing surveys, doing interviews and the like, that in one region that is on the opposite side of the world, and we can actually have another team on the other side of the world actually start to make benefit and start to work on addressing some of the challenges that they identified as well. So there's real benefits of working that way. We also had the benefit of really seeing how various regions, various cultures are very different, and that you need to understand those cultures deeply in order to actually come up with appropriate solutions as well. And the other thing is that it's really beneficial and really rewarding to work with others on a challenge like this. So, while designers and anybody else for that matter, when you do your work, whatever your discipline is, to for the benefit of the company that you work for, no matter what kind of industry or organization you're working in, there's a real sense of reward in working on problems that really have impact, that makes the world a better place, really addresses some really, really core problems. And I think to a person, the people that worked on this design challenge really found it meaningful that they got to contribute in a positive way to addressing something that they were all rather scared of, that everybody was very, very concerned that they were all now working at home. Nobody knew, and we still don't really know, how everything is going to turn out with regard to, this pandemic. But they got to have some impact. They got to actually work together. And the other part about working with others is that they weren't alone sitting at home thinking or worrying about this. They were making an impact with others that they now actually found were friends. And these are people that didn't know each other at all before this, right? Really, really, really powerful. And there were insights from people that may have been, just a student straight out of school or even in school, getting huge value from now getting the experience of somebody that's been in the industry for a while. And then interestingly, the converse as well, people that have had lots of experience at this, but also seeing some really fresh new ideas from some of the other people that we had as well. So incredibly rewarding experience. And we share on the website some of the stories that some of the people that were involved in this design challenge, what they thought and said regarding their experience with it as well. So what are we doing next? This first one was done. We have the website up there. We have a number of the projects, as I said earlier, are like the informational ones. You can go in there, just download the images and share those images. They're still as relevant today as they were when we first put it together. So you can share those images to encourage appropriate safe behaviors and the like. The other projects that are web apps, for example, or mobile apps, a number of those are in the state where they are being developed, and that the teams are looking for additional members to join them. And we've had a lot of people doing that, where somebody has volunteered to contribute their skills to a particular project. There's also been a couple of projects that have become kind of startups of their own and starting to be an organization all of their own, as well. And then there's others that there's information there that you can just download and use, and actually go and develop some new ideas from those ideas that were created there as well. So that's how that project ramped up. And we're looking to launch Wave 2 in the beginning of 2021. And we're also looking at particular themes. Some of these were themes that were left over from the exercise we did that I mentioned at the beginning of my talk, where we looked at the most impactful and urgent at the time, and this was in sort of the March timeframe, around that time. Well, now we are at a state where we can now look at some of the other items that we also wanted to address. So things like climate change and the environment, which obviously is heavily related to this particular topic that we're in right now anyway, but more broadly, what kinds of things could we use these kinds of methods and the design skills and methods that we have, how could we have an impact on improving things with regard to climate change and the environment? Also, how can we prevent future pandemics and also be more ready for them if they were to come again as well? A real focus on designing the new normal. We're realizing that this isn't something that's just taking a few months and then we're going to be back to everything the way it originally was before we started this whole experience with going through this pandemic. We all realize that things are probably going to be different in many ways in the future. And so everything from people working from home, and that organizations and companies making a decision to actually encourage that kind of thing. Some companies have also decided to not have offices anymore, and that everybody's now working from home as a regular aspect of work. Everything from the differences that we now know that we need to implement in the world. This is a wake-up call for many in society that we need to be doing things differently. Well, let's not just let those happen. Let's actually design what that new normal, might be. And part of this whole realization of where we've found ourselves stepping back and reflecting on, the world the way it was before this pandemic hit, and thinking about that we might want to use this as an opportunity to design a new world, one without racism, one without inequity, one without the kind of divisiveness we see around the world, as well as inside countries as well. What could we really do to make an impact on those incredibly important and huge challenges that we've got around the world? I firmly believe that we're now at an inflection point in the world where people are way more open to new ideas. Governments are open to new ideas. Organizations and companies are open to new ideas. And rather than having a vacuum or just a bunch of people throwing out some ideas for what might be the new way to do these things, I argue that the methods that we've used here, the methods of enterprise design thinking, and I would add to that as well, strategic foresight, or speculative futures is another term for that, where you do the enterprise design thinking kind of work, but you also have a look at trends in society, including trends in this pandemic, and you look at alternative ways that the future might turn out, and what other ways could you design whatever it is that you're working on. How could you design, if this were going to be the outcome, what should the design be? And if this is the outcome instead, in a different scenario, what should we design with regard to that outcome? And if we do that, then regardless what happens in the future, you'll likely have a solution that is ideally designed to address that reality. So that's, I think, what we all need to be doing in looking at no matter what kinds of challenges that we have across the board. And so I think the other approach is that we should be thinking about, again, this experience we had was really a positive one in the sense of actually showing the power of using these methods or for addressing big challenges that are not just designing a product or designing a service. You can actually address real world problems using these methods, which makes us think about, let's start to think about what kinds of challenges we should be applying these methods to as well. And I think there's a huge opportunity for doing that on a regular basis. So I encourage all of you to think about the challenges that you might be seeing, and they don't have to be huge, but they could be, whether your organization is going to adopt a work from home for permanently solution, for example. Perfect challenge to be able to use these methods for. What do you want to do? You want to be able to look at all aspects of the organization, the people that this is going to affect, and then actually understand their perspectives well, and then design solutions based on future scenarios, and also factoring in those users, those humans that we have that are in the equation, as well. Because I think together we really can design a better world together, and using these kinds of methods. So I would like to thank you for taking the time to listen to my talk. I also would encourage you to visit the COVID-19 designchallenge.org website. You can see lots more there in terms of the kinds of things that came out of this particular project, as well as more detail on what we actually did do throughout it as well. Become part of some of those projects. and then even replicate those projects as well in what it is that you might have as challenges that you want to address as well. I also encourage you to go to ibm.com/design/thinking to be able to learn these methods. And again, it's entirely free. You can just go through and learn the methods, practice them yourself. There's a practitioner's badge, and then there's a co-creator's badge that you can get as you use these methods on an actual project. And that can actually directly impact the way that you actually do one of these projects yourselves. And then lastly, I would just encourage you to connect with me further. My website is my first name, last name.com, so carlvredenberg.com. I blog there quite regularly. You also see linkage there to do a podcast called Life Habits. And you can also get in contact with me there too if you have any further questions about any of this. So with that, I'd like to thank you very much for your attention today. And also I encourage you to use these methods in trying to together make the world a better place. Thanks very much.
네, 고맙습니다. 카렐 브레덴버그.
Thank you very much for your message. So the IBM's academic director, Carl Brandberg, talked about the approach to addressing the challenge. As a designer, to tackle the global challenges from the point of designers, all people were participating in this project from home, and we shared the experience. So on top of the notion of loop designed by IBM, we could draw a better solution for the COVID-19. And we could find a new possibility to address this kind of global problem. So it was all the more meaningful. And we could solve various problems in this way. So I think you can be the main character of solving those problems. And let's move to the next stage. And next is the social problem solving design, reinforcement of resiliency capacity through design, told by Lee Hae-young.
안녕하세요.
Good afternoon. I am Lee Hae-young from the SMG Design Department. So in this kind of disaster situation, how can we reinforce the resilience of the cities? I think you've heard about this phrase quite a lot. So the Albert Einstein mentioned we cannot solve our problems with the same thinking we used when we created them. So if I have 1 hour to solve one problem, then I will use 55 minutes to define the problem and make a solution for 5 minutes. And I'm dealing with planning, and I worked for planning and drawing a the plan. And SMG's the plan is very segmented, but after the COVID-19, I just thought that we should be very able to deal with these problems immediately, just like the Albert Einstein mentioned. It is too complex and it's not easy to diagnose the problem. Then we have to define the problem, and the thinking for the problem itself is very important. And there are a lot of gloomy articles in the newspaper, and it's totally different from before the COVID-19. And various problems which were dealt in the government affairs were overlapped with others, and it got strengthened, and the social system was locked down due to the disaster, and the socially vulnerables went more vulnerable, and the general citizens also felt fatigue, and they happened to feel the loath, and they were expressing their ideas more freely, and it was becoming a bigger risk. And then what kind of city can is more vulnerable to this kind of risk disasters, and what city is more efficient to deal with this. And when we talk about the resilience, it's about competency of one person in psychology to deal with the crisis or to overcome the difficulties. And then we apply this concept to the ability to deal with the natural disasters and terror, or the society or cities are going through these kind of disasters and deal with it. And to describe the notion, this word was used again, and that was the resilience. And you see this kind of the interaction, the adaptability, and vulnerability, and there are various elements. The involvement, competency strengthening among the interested, and securing the sustainability of the service, encouraging the participation of the community, and natural or the artificial resources connection, and so on. So these were actually matched to the principles pushed by the SMG's the social problem solving design. And if we cannot proactively deal with this kind of strengthened or worsened social problems, the vulnerability level of the city will get worse. So after the COVID-19, against the diversified and segmented problems, we have to reflect the perspective of these general citizens before defining the problems, and also we have to consider their mental and also sensible the areas to set the direction of design. And as you see the 12 the elements, and from now on I will show you what kind of the design solutions we've made to cover the needs of general citizens, seniors, and the youth. And I will try to explain those projects through some of our policies. These days the single households portion is going up, and due to the COVID-19, the social distancing has been strengthened and longer, and it is actually triggering the unknown death. And from the year 2014, to help the dementia patients, we were actually implementing the cognitive health design project so that the individual's residential area can have guidelines to take care of it, and also to help our seniors to use their brain much more, and then they can live a healthy life. And also we provided some of those designs to prevent the fall and the fire so that their safety could be at the first. And also the anti-slippery the measures, and falling should be prevented, and safety chairs should be prepared in this kind of the toilet or the restrooms for the single households of the seniors, so that we can prevent this kind of accidents. And it's very important to place the familiar pictures or familiar items so that they don't have to feel awkward to see the unfamiliar items. So they can make this very colorful and beautiful the items, which is the door plate, and then they can leave their place. And after that, they can see the exit, and they can remember the exit path. And to reduce the confusion, we matched those colors. And also at the main gate of the apartment complex and some of those other gates, their colors were matched to prevent the confusion. And there are some of those like North Korea defectors and the single house seniors, and their household proportion is increasing, and poverty, the single death, and a lot of problems are happening. So they are not doing anything, and they are suffering from diseases. So all these four kinds of diseases should be improved, and also providing the rest place for these vulnerables are also serving as a solution, and to help these measures can be fairly well and implemented at the scene. The LH and NH are helping. This is the one of the welfare centers in the Kumcheon-gu in Seoul, and our seniors are visiting this place. But well, there was no one single bench to take a rest after having lunch, so we made a 100 years old the gardens, and we planted some of the flowers and the trees, and then they could enjoy some of those paintings and the artworks, and they could touch some of those the tiles, and then with some of those pictures and the drawings, so that they could enjoy this kind of artistic the fun. And sometimes we had to miss some other staff, putting the plexiglass between them because of the COVID-19, but we are trying to provide more emphasized the consulting service. And after this kind of problems, the domestic problem is also increasing because the portion of the working from home is increasing. So, well, before we were trying to understand each other before, but because everyone is staying at home, so this kind of conflict among the neighborhood had been worsened, and the communication was not done very well. So, these SMG were spending 6 to 7 months to go through the course, which was suggested by the citizens, and this is the design governance project. And also, some service designs were made to relieve this kind of conflicts among the neighborhood. So if there is any the construction or the interior project, then or you're moving in, or you're having an event, then this kind of the events were notified through this kind of signage.
만들었습니다. 직접 다른 이웃에게 찾아가 말을 꺼내기 힘든 상황인 경우에는 나누고 싶은 물건이 있지만 누가 필요한지 잘 모르는 경우가 있고, 또 내가 가본 멋진 장소를 이웃들에게 알려주고 싶지만 여건이 안 되는 경우에, 또는 감사한 일이 있지만 직접 얼굴을 보고 인사를 나누기 힘든 경우에 카드를 통해서 이웃과 커뮤니케이션을 할 수 있게 되었습니다. 실제 이 게시판이 설치되고 6개월간 아이들의 물건이 교환되고 또 햄스터 분양이 이루어지고 하는 등 총 200건의 카드가 사용되기도 하였습니다. 세 번째 문제는 디지털 과의존입니다. 온라인 수업으로 바뀌면서 청소년들의 스마트폰 중독이 심화되었습니다. 스마트폰 등 디지털 매체는 시청각 감각을 과도하게 자극하고 촉각과 후각, 뇌 기능을 떨어뜨려서 인지 능력, 학습 능력 저하와 주의력 결핍 등의 문제를 유발하게 되었습니다. 특히 청소년기에는 한 가지 감각이 아닌 오감을 모두 사용하는 것이 중요한데요. 식물과 자연을 매개로 한 자극이 감각을 통합하고 잠자고 있던 신경을 활성화한다고 합니다. 서울시는 2018년부터 청소년 문제 해결 디자인의 일환으로 마음풀 프로젝트를 통해 학생들의 일상 공간인 학교에 식물을 들여왔습니다. 보시는 바와 같이 마음풀 정원에서는 식물을 재배하기도 하고, 또는 천정관수를 통해서 실내에 비가 오는 것을 경험할 수 있기도 합니다. 눈누난나, 띵까띵까와 같은 이름들은 아이들의 상상력을 자극하기도 했습니다. 그리고 식물마다 이름과 특징을 적어두어 아이들이 스스로 관찰하고 또 관리할 수 있도록 했습니다. 학생들이 식물에 직접 물을 주면서 흙냄새를 맡기도 하고, 식물을 만져보고 식물의 성장 과정을 함께 지켜보았습니다. 그리고 속상한 일들을 적어보기도 하고, 또 물로 씻으면서 이것들을 해소하는 경험들도 해보았습니다. 식물을 활용해 맛있는 음식도 만들어보고 친구에게 줄 화분도 만들도록 했습니다. 이렇듯 서울시는 스마트폰에 익숙해진 아이들이 마음풀에서 식물을 매개로 다양한 활동을 진행함으로써 한 가지 감각만이 아닌 오감을 골고루 쓰면서 성장하는 계기를 마련하고자 하였습니다. 그 결과 학생들이 정서적 안정을 찾고 교우 관계도 개선되는 등 좋은 성과를 보였습니다. 네 번째는 정신건강 개선을 위한 스트레스 프리 디자인입니다. 보건복지부 한국트라우마 스트레스 학회가 지난 9월 10일부터 21일까지 전국의 19세부터 70세 성인 2063명을 대상으로 진행한 코로나19 국민정신건강 실태조사 결과를 살펴보니 코로나19가 국민정신건강에 지속적으로 악영향을 주는 것으로 나타났습니다. 서울시는 현대인의 정신건강을 디자인으로 개선하고자 16년부터 본 사업을 추진 중인데요. 16년도 생애주기별 조사 결과 10대 청소년의 스트레스 인지율이 가장 높은 것으로 나왔습니다. 청소년기는 신체적, 정서적 과도기로 성인보다 스트레스를 더 심각하게 체감하며 더 많은 부적응 문제를 일으킬 수 있으나 이에 대한 적절한 대처 방안에 대한 학습 기회가 없어 대부분의 청소년들이 이를 참거나 그냥 회피하는 방식으로 스트레스를 해소하고 있었던 것입니다. 학생들이 가장 오랜 시간을 보내는 학교 내에 빈 교실들이 있었는데요. 이것들을 활용하여 스트레스를 올바르게 이해하고 또 진단하고 그 결과에 따라서 공간에서 쉽게 스트레스를 풀 수 있도록 스트레스 프리 존을 조성하였습니다. 마음 상태를 패드를 통해 입력하면 그 결과에 따라서 음악 감상, 컬러 테라피, 아로마 테라피 등의 해법으로 제시되어서 스트레스를 줄일 수 있었습니다. 이 사업은 청소년기 스트레스에 대한 바른 이해와 관리에 대한 학습을 통해 미래의 성인이 되었을 때
In order for them to have a healthy adult life, it was very meaningful in that sense. And also for the stress-free project for the citizens, it was targeted for the seniors and the elderly, which provides leisure and cultural programs. All members were tested for stress and depression on their daily lives and also conducted this MBTI to match or to provide a customized welfare center programs. We conducted psychological counseling for the elderly on the regular basis to detect a seriousness level of their stress, and if exceeded a certain level, we would connect to a mental health specialist at a university hospital. And this model is an unprecedented service that we would actively connect spaces and programs, and it is expected to expand in earnest next year. We are also using to relieve the stress, to analyze the stress that is derived from the residential areas, to see what are the stress factors by the young generations and also the seniors. By doing so, we can find out what are the stress factors to provide psychological counseling to the students, and so which will be connected to the public services. By doing so, we'll be able to continuously manage their stress, and the stress is not only derived from physical environment itself, but there are also many other factors that cause the stress. As you can see here, SMG has been actively promoting the social problem-solving design policy, and I think this is part of this design problem-solving policy. We would be encouraging to overcome the vulnerabilities of the social problem-solving, and also to promote public design projects as well to enhance the resilience of the cities. I believe that this shows the 12 principles that we have induced after promoting projects and policies regarding social problem-solving design. We need to focus on the design thinking, and during the process, we need to have it more visualized to take in a comprehensive measure and do checks in between. On the solution approach, we need to take a balance between hardware, software, and humanware, and also connect them together to bring a complete resolution. Also, we need to utilize the efficiency and put the citizens at the very center and prioritizing them to resolve this issue. We have endured a very hard time due to the COVID-19 and to minimize contact and using social distance. We believe that this was the most active way of overcoming the COVID-19. However, most of the groups, even though they're protected, the vulnerables who aren't protected, which means that the whole society itself will be at its vulnerables, which means that our society itself is connected, all connected throughout. Seoul Metropolitan Government would like to take a different approach or a new approach to define this issue, to use the social resources to resolve this issue. Thank you for listening.
과장님의 발표였습니다.
Thank you very much, Director Lee, for your the presentation. So SMG's focus is that putting people at the center. So we were implementing several policies to strengthen the resilience, and we will work harder than that. Dementia, the neighborhood's conflict, and the youth problems. Not only those, but the mental-related problems will be solved from the perspective of design. And they explained by Dr. Lee, and I hope we can live freely and in a good manner in the safe city once again. And let's move to the next session. Next session is by the Joanna Frank, the Fitwell, the Building Health for All in the face of COVID-19. And several the changes have been made, and the Fitwell means that the environmentally friendly building the certification system. So smart technology is also needed, and so to cope with COVID-19, how can we improve the design of the building in the face of the COVID-19? The Joanna Frank will explain about it.
Hello, my name is Joanna Frank. I'm President and CEO of the Center for Active Design. Welcome to Building Health for All in the Face of COVID-19. The Center for Active Design is the leading international nonprofit organization translating between public health research and all aspects of the built environment. We have been working for 10 years translating between public health research and all aspects of the built environment. In that 10 years, we have put out many publications, which started with the Active Design Guidelines, which actually were published by New York City while Michael Bloomberg was still mayor of New York City. So the Active Design Guidelines just turned 10 this year, and this was really a groundbreaking publication. The next publication that we worked with was with ULI, the Urban Land Institute, a global organization working with real estate developers. We've also put out Assembly, which was a publication looking at how do you design our public realm, our urban realm, in order to optimize it for people, really looking at how do you build trust and social ties, social connections for our public using design as that medium. And now what we're really going to talk about today is Fitwell, the building certification system that we, the Center for Active Design, operate. When we started the Center for Active Design 10 years ago, there was really no demand from individuals for health promoting environments. In fact, when we launched the Center for Active Design, we actually had front page headlines in the New York Post about people telling us, you know, don't tell me to take the stairs, don't tell me to walk down the street. But a lot has changed over the last 10 years, and we'll get to COVID in a second. But even before COVID, there was a really strong demand for health promoting environments. And why that is important to the design community is that your clients were really already demanding that their office spaces and that the buildings that they own and operate really provide these health promoting environments for their tenants, for their occupants, for their residents, and for their employees. And this was really being driven by two factors. It was being driven by the individuals that were within these buildings. On the employment side, that was coming from employees. So employees, here you can see 75% of employees were really demanding that their employers, the companies that they work for, provide health and wellness as part of that experience of a workplace. And so, of course, as an employer, you need to be able to attract and retain talent. And to be able to do that, you have to provide your staff with environments that are overtly health promoting and really meet the needs of your staff. And so we were already seeing a really strong demand for those health promoting environments from businesses around the world. You can see here, this is a CBRE office, I believe it's in Shanghai, which is a Fitwel project. And so this was driving demand from clients, from businesses, from large employers, from small employers as well, actually. And we were hearing this from the architects and the engineers and the consultants who are then working with Fitwel to provide these spaces for their clients. And this is kind of how this works with the design elements. So this is just an example of kind of how the health evidence then helps to inform how those spaces are designed. So this is just an example of that evidence base. So this is Daylight, just as an example. This is actually the Bloomberg headquarters here in New York City, which is also a Fitwel certified space. But just a kind of an example of how the evidence base works. So people who sit in spaces that actually have good lighting compared to those who have bad lighting, what we see from the evidence base is that those who are in the worst lit spaces actually, on average, take 16 more hours of sick leave a year. And if you start to extrapolate that across an entire workforce, you can see that that has a real impact on business outcomes, on productivity, and actually just on costs. So you can see why that would have a big impact on the bottom line of a business. And you can see also that that is obviously having an impact on people's health. They are taking 16 hours a year, 2 days more of sick leave. So this is kind of how you can see that design elements such as access to natural daylight is having a direct impact on people's health, and people's health is having a direct impact on business outcomes. And so this is the rationale, this is the thought process that is really driving this demand for health promoting environments within the business sector. And then the other big trend that we see that's building and growing demand for the health promoting environments is one of an investor-driven trend also. And that is the environmental, social, and governance trend from investors that we see that is growing. The demand for this was already growing pre-COVID, and that we have only seen this accelerate during and continuing really during the COVID pandemic. And this is really looking at investors, global investors, who are looking to invest in companies and in projects and in real estate and any kind of investment vehicle that is meeting ESG metrics, so environmental, social, and governance metrics. And those are measurable impacts. Those are projects that are meeting those environmental, social, and governance metrics. And obviously real estate can do that. And we as Fitwel are meeting those S metrics, the social metrics. This has been a growing trend over the last decade, really. It's grown exponentially over the last decade. And what we're seeing, the driver for this, again, is the youngest generation of our workforce, the millennial generation, are really prioritizing as they are investing their pensions for the long term. They are saying that I want my future investment in my retirement to really go into impact investing. And that amount of wealth that they're putting into their long-term future is actually a vast amount of money. And that is driving this kind of, one of the reasons that it's driving the ESG investment trend. I just heard a stat the other day that the amount of money in pensions plans in the US is 34 trillion. And individual wealth is actually in ESG is 64 trillion. So these are huge amounts of money that are anticipated to go into ESG investing. And so these are the two drivers of why we're seeing all of this interest and really kind of emphasis on projects that are really prioritizing environmental, social, and governance metrics and reaching these goals. And prioritizing health is obviously an integral part of meeting those goals. So this is what we're seeing kind of at the macro level, at the largest level. So Fitwell was started actually not by the Center for Active Design, but it was actually started by the Centers for Disease Control and Prevention, by the US CDC, which has probably been in the news a lot because of COVID, but it actually started Fitwell about 8 years ago now. And then the Center for Active Design was selected as the operator of Fitwell about 4 years ago. So we are the exclusive operator of the Fitwell certification system, which is a healthy building certification system. We have been operating it across the world now only since June of last year. That's when we expanded the system to have international standards. So we launched it publicly 3 years ago, and then really as a global standard, as I said, in June of last year. And we can talk a little bit more about that. But the CDC remains our research and evaluation partner, but we otherwise are the third-party certifier and have all operational control of the Fitwell certification system. And it's exciting to see how it has grown over the years. Fitwell looks at health holistically and is in line with the World Health Organization definition of health. So we look at all aspects of physical, mental, and social health. And every strategy within the Fitwell building certification system actually impacts at least one of these health impact categories. So every strategy impacts at least one of these health impact categories, and many of the strategies impact multiple of these categories, and as is supported by the public health research base. So every strategy in Fitwell is supported by the evidence base, and that's really important because there is a huge amount of public health research that is underpinning the Fitwell certification system. So everything that we do is evidence-based. It always has been. That is the foundation of the Center for Active Design. In our databases underpinning Fitwell, there are more than 5,600 peer-reviewed research studies coming from academic institutions around the world. And there's an algorithm under which we use to actually generate the weighted point allocations of each of the strategies in Fitwell. And what that means is for every strategy in Fitwell, you get a different amount of points, which actually allows for you to prioritize these strategies based on the number of points that you get. And those points obviously denote the level of impact for each of those strategies. And so that really allows for projects to say that with confidence, we know that this strategy is going to have a greater or lesser impact than another strategy on the health of the occupants of this building or the residents of this project or the neighborhood, because we also work with site scale as well. And that has really been groundbreaking. And the research behind that algorithm and the research behind that original weighting was actually done by the CDC. And it was a massive effort. And really kind of sharing that knowledge with the broader community, with the design community, is something that we're really proud of. And I think it's again been a groundbreaking achievement to be able to share that level of knowledge. And so that's kind of the real underpinnings of the Fitwell certification system. So the way that it works is that the strategies in Fitwell are organized into a series of different scorecards that are directly applicable to different sectors and different uses. You can use Fitwell for existing buildings. It was originally designed for existing buildings because the original user of the Fitwell certification was actually the US federal government. So the CDC partnered with its counterpart in the federal government who manages the US federal government's portfolio of existing buildings, 9,000 existing buildings actually. So existing buildings were the first user of the Fitwell certification system. And so we still have the vast majority of the buildings that use Fitwell are existing buildings, which we actually believe are the harder use case. So we really like to design for that harder use case. So many of the buildings that use Fitwell are existing buildings, and really looking at how can you use the Fitwell certification system to make incremental improvements to the buildings that you already have in your portfolios and that you're working with. through a renovation process or by making policy changes, operational changes, even outside of a big capital investment. So very important that we look at incremental changes, as well as, of course, the new construction. So we do have a good amount of new construction projects. It's just that the majority of the buildings in the system are existing. So we can talk about a little bit about the different certification scorecards that we have, as well as the different ways that we work with the community. So we have different programs, different ways of working with the building industry. As I said, we support all different aspects of the building industry. So we have what we call our Fitwell Champion program. So we work with owners of portfolios of buildings. We call those our champions. And so that's when we work at scale with companies who own portfolios of buildings. So those would be designers' clients, basically, folks who have a lot of buildings. We work with them at scale. The Fitwell Ambassador program is a professional development program where we work with individuals, usually folks who are architects, engineers, consultants within the A&E community. So that's an individual accreditation program where you go through the Fitwell training and you become a Fitwell ambassador. We have a lot of A&E professionals who are becoming Fitwell ambassadors and really learning for themselves about how they can promote the health and wellness of the folks who are going to be occupying the buildings that they are designing, that they are working on. And this has been a very popular program. And we hear a lot from the architects and engineers and designers that we interact with, that they really want the same knowledge that we have at the Center for Active Design, that this is of real interest, that there's a real thirst for this knowledge. Very few people who've been through architecture and engineering degrees have actually been trained in how they impact health. This is relatively new as far as the education of the design community. So we do feel it's our responsibility very much to kind of share the knowledge that we have acquired over the last few years with the broader community. So that is the Ambassador Program. And then the affiliate program is similar to the Ambassador Program, but it's really for A&E companies. So if you are an architecture and engineering company that wants to work at scale with your clients, that we, the Center for Active Design, will support you and actually provide your whole company with training and to provide you with ways that you can work with your clients with discounts and so on, and really kind of work at scale. So this is kind of akin to the Champion program, that we will support you working with your clients at scale and provide you the knowledge to really have an efficient program and process to go through that certification system. We have Fitwell ambassadors all around the world, which is really exciting. These are the top 9 countries that have Fitwell ambassadors. I think we have Fitwell ambassadors in more than 40 countries around the world. So it's really exciting to see how this is growing, and that I know that we have a lot of Fitwell ambassadors that actually meet up with each other, and there's a really strong and growing community. So we welcome you to that. I just want to give you an example of kind of what the research looks like when you put it into practice. So this is just an example, kind of, this is classic active design, but it still holds true today, and these are all Fitwell strategies. So when you walk into a building and the first thing you see is a stair, you are much more likely to actually walk up that stair, and the research supports that. If you add a prompt that tells you it's good for you, you are even more likely to walk up that stair. It actually increases the likelihood by 8.1%. And walking up the stairs, just 6 flights of stairs a day, actually decreases or offsets the average annual weight gain of an American, which is £1 a year. And then the economic impact of that in US dollars is actually that you save between $83 and $103 of medical costs a year. So just kind of to give you a tangible impact of what we're talking about. And then I just want to close by kind of talking about how we've been responding to COVID. So we are obviously a trusted partner to the building industry, to designers, to building owners and investors because of Fitwell and because of the work we've been doing over the last 10 years. And so when COVID was declared a pandemic back in March of this year, we really were hearing from our partners in the building industry that they were really looking for a credible and science-based response to the COVID-19 pandemic, and really for guidance on how they should be responding to the pandemic in their buildings, in their design practice, and really what was the best science, what was the best approach for this pandemic. And so our team really went back to basics, what we always do, go back to the research base and really understand like how to provide that guidance to the real estate industry. So what we decided was the best course of action through a lot of research and talking to all of you and to the building industry and our research partners was that we would provide annual third-party certification for policies and practices that we have informed with the latest public health research. And we're really looking to mitigate the spread of infectious disease within buildings. So we've created a new certification that we call the viral response module. The first thing that we did when the pandemic really hit was we spent the first few months, first kind of 4 months really, reviewing the research. We reviewed the research not just for COVID-19, but also other respiratory infectious diseases. So we broadened the research base to look at SARS, H1N1, and other respiratory infectious diseases. So we broadened the research base so that we could not just look at mitigating the current pandemic, but also look at mitigating future pandemics and really kind of come up with something that was a broad approach to this current issue that we have. So we published that research earlier this year for free, and everyone is welcome to download it. The link is down there. So this is a publication, it's 5 chapters where we look at mitigating viral transmission. We look at addressing the mental health issues, both in the workplace, but also residential settings. And then we also look at how do you build dense environments that are optimized for people, and also how do you look at the underlying disparities that we have within our populations so that people are less likely to be impacted negatively if they do contract COVID. My hometown, as I think I mentioned, is New York City. And New York was very badly hit by COVID back in March, and 89% of the people who died of COVID in that first wave had an underlying comorbidity. So we understand that addressing underlying health impacts, underlying health issues is of high importance, as well as obviously addressing the infectious disease that we're currently suffering from. So really looking at mitigating chronic disease is still a very high priority, as it has always been. And that is what the Fitwel building certification is really looking at always, as well as obviously now adding this infectious disease module. One of the other things we did was we added additional expertise to our academic advisors, and we added a whole group of amazing world-leading scientists to our academic advisory. So in addition to the Centers for Disease Control and Prevention, we added academic advisors who have expertise in infectious disease and epidemiology and mental health and behavioral psychology, so that we could really understand the best research in addressing infectious respiratory diseases. And then we also had amazing industry advisors as well, who gave us advice on what they were really looking for in response to how to address COVID for their portfolios, for their individual assets, and what they were needing. What we did was we created this viral response module in 3 sections, 3 equal sections, looking at how do you enhance your indoor environment. So that's looking at air quality, filtration, cleaning protocols, encourage behavior change. So that's really kind of the mask wearing and the social distancing, and then building occupant trust. So that's kind of the mental health, that's trust, communication plans, etc. And I'll just kind of briefly go through those. So enhance indoor environments. So that's establishing an enhanced indoor air quality policy. The other thing that's different about the viral response module for Fitwel compared to our building certification and our site certifications is actually that we have minimum requirements as part of the viral response module, and in our building certification and site certifications, we do not have any prerequisites. And there's a very good scientific reason for this, that when you're addressing infectious disease, there are minimum requirements that you need to hit in order to be able to say that you are addressing infectious disease. Whereas in our building certifications and site certifications, you're really looking at holistic health, and therefore you really can choose your own path to optimize that environment, because you aren't addressing any one particular aspect of health. You're really looking at optimizing the environment for holistic health. So the rationale and the evidence base behind the two different certifications are different based on different research. So for the infectious disease, for the viral response module, we do have minimum requirements. So the bolded text are those minimum requirements. So all viral response certified projects will meet these minimum requirements. Establish an enhanced indoor air quality policy is one, and the enhanced cleaning protocols is the other one for the enhanced indoor environment. On the behavior change section, we're looking at PPE, so that would be your masks and other personal protective equipment, supporting hand hygiene, always been in Fitwell, having those hand washing signs and so on, not that anybody used them very much, but they might now. And then providing select educational health promotion signage. And there's a nice example from one of our big users, Tishman Spire. So like I said, this has always been part of Fitwell because it is actually part of the evidence base. Obviously now folks are much more aware of just how effective this can be. And then the last section is the building occupant trust. Again, mental health has always been part of the Fitwell building certification. We call it instill feelings of well-being. Obviously, mental health, I think, is people are really beginning to understand how impacted our mental health has been with COVID. Trust is an essential part of bringing people back into our environment post-COVID. So there are some minimum requirements here as well. So establishing a contagious disease outbreak preparedness plan, establish communication plan, and also establishing minimum sick leave requirements are all part of the minimum requirement as part of that base for the viral response module. This is new, it was only launched a few weeks ago. We do have some folks who've already committed to using it, and we've actually got a few folks who've already submitted for their certification and even been certified. So it's really amazing to see the response. We really appreciate that. So it is incredible to see the demand suddenly for public health. And obviously COVID has just changed. I think someone said that health used to be a nice to have, and now it's an essential. And we've certainly seen that in our work. And I think as designers, you're all, I'm sure, hearing that it used to be something that maybe a client would say, oh yeah, it would be great to kind of think about the health. It would be great to think about sustainability, but it would probably not be the first thing that they told you they were looking for in a project. And now I think you'll find that it is probably one of the first things that they talk about. It's that they really need to prioritize how are they going to prioritize the health of their employees or their residents or their tenants or whomever it is that they are going to be, whoever their stakeholders are. So I think that health and is now a high priority for everybody. And the designer's role is really to be educated and to understand both how to directly impact the health of the stakeholders for a project, and also how impacting the health of the stakeholders is directly in the best interest of your client, like why it makes sense, business sense for the client directly to be doing that. So with that, I would hope you stay in touch. We put out a lot of information. All of our information can be found on our website. We put a lot of information out for free. We really see ourselves as stewards of this information. A lot of this is peer-reviewed public research. This is not information that we create. We are the translator, and we translate between what you need and what the academic institutions are creating as far as research is concerned. And we really see ourselves as partners to you. So we look forward to and welcome your feedback. So thank you so much.
네, 고맙습니다.
Thank you very much for your presentation. Joanna Frank, the CEO and President of the Center for the Active Design. So more than 70% of the daily lives is spent within the building. So we were just spending a lot of time in the building, but I never thought about that the building itself should play a role of improving the health of the people or the tenants in it. But we're spending more time and time in the buildings. And then it is not an option but the mandatory the responsibility for buildings to provide better health for their tenants. So well, maybe you heard about it, but it's recently coined the accreditation system, but actually it was picked as one of the 10 the outstanding certification system in the world. And just like this kind of like eco-friendly the buildings certification system, I hope that we can have more the healthier the buildings in the future. And I just looked into some of those the YouTube chat, and I never thought how the social challenges were addressed in the foreign countries. And then I could find that thanks to this forum, and I think that is the advantage of this kind of online forum. So by inviting the outstanding speakers, we could have this kind of insights. And we prepare several other the presentations, so I hope you can stay until the very end to pick up valuable insights. And also, I think you are wondering whether can we see this kind of video after this event. After the end of the event, you can still watch these video clips, so don't have to worry. But I hope you can enjoy watching the meaningful event and forums, the clips. And let's move to the second session, design coping with the crisis. First, the Yoon Joo-hyun will talk about the design leadership for crisis response, unexpected event, and humanities. Let's start. Good afternoon. My name is Yoon Joo-hyun. So design leadership to cope with the crisis, that will be my topic. Technology, design, society, and humans. So these are the 4 topics. So technology is a crisis or an opportunity. If you look at the left side, you see the Muto's chair. But if you look at the second and third one, do you think you can make this kind of chair? Actually, these chairs were created by a computer. So this Otos, the designer company, were making this kind of generative the technology. On the other hand, Logojoy, Telebrand, on these websites of these companies, if you just inject some of this information of your company, and then your company's logo will be created, and the sales was like 20 billion Korean won in 2018 and 17.7 billion Korean won. And also there's a company called BBB in Korea. The designing is free, and then you just have to pay for your business cards and the printed items. So the Boo.com or some of those other companies in the UK and the States, you can also print out the materials that you want. And they were achieving 100 billion won from Boo.com, and the Australia's Canva.com or also made the 55 billion Korean won in 2018, and they were merged, and then they became a unicorn company and they advanced into the Korean market. Do you think is it a crisis or an opportunity? In Korea, Kumo was initiated with its business in 1220, and product 3D and the video they were made, and then they also generated a lot of sales. And it's called Notefolio, and they were merged and they made a new company, the Stunning. Maybe you can say, oh, it's a very interesting news or it's a fun news. Then maybe if you're a designer, you might think, well, what should I do with my life? How can I make a living? Then if you're a designer, what do you think you should think of? So we're only thinking about the process. And then what is the reality of the design? And then we have to think about it at this moment. So AI, sensor, IoT, big data. So maybe we were like thinking, how can we attach other words? So that was the design thinking. But now we have to think about how to combine these kind of advanced technologies and other the concepts like responsibility, justice, and truth, like people, environment, cities, and culture and relationships. They should be also embraced when you think about this kind of designing. So we have to find the design that you can find lost humans. And I think that's the new desire for designs. Well, if you're a person, then you have a lot of desires. Maybe it is just natural desire or desire to save, or you want to get recognized and you want to seek for the safety. I just want to show you several signages for the safety. If those are touched by a designer, then it can be more beautiful. But these signages can help save some lives. So in this area, you can see the yellow carpet because this is like accident-prone area. After pouring the yellow paint on the street, the ratio of car accident decreased and children could have fun on that street. And Victor Panner made this kind of the artwork, and he created a radio. And also you see the Q drum. These kids have to pick the water from the well, but they don't have to hold it on their shoulders or head, but they just have to pull these drums. Do you know that during the 4 years for World War I, 9 million people lost, and 17 million people lost their lives during 6 years for World War II. But for 11 months due to the COVID-19, 1.2 million people lost their lives. So at this point, we have to face that we are really facing a real crisis. John Ruskin mentioned that the majority are happy and minority are sad. Well, we need to make a design for that kind of society. That's true in some ways. Well, we have to think about the origin of the humans, and we have to think about our ideology to create the design for the future. So that is the inclusive design to realize the inclusive nation. Design for minority. You might think of only like 1% of the population, but when we think about the minority these days, design for the vulnerable or design for the dementia patients, or design for the society, these designs are becoming more popular, and that is the core to make people to enjoy the equality and freedom. Then how can we make a design for all? How can we create a design to protect the society? So I just made the list of not the basic desires of humans: the safety, the communication, survival, climate and environment, welfare, the mobility, safety, etc. So based on these basic desires, what are the strategies and what can we do with our design? So in this way, I created a framework for the better future applying the design. In 2018, the Korea Design Promotion Institute made a dedicated the city regeneration organization, and in 2020, on July 30th, they made a special act on the city regeneration, reinvigoration, and support. So the city regeneration was actually included as a paragraph of this regulation, and city regeneration framework and human's desire, those were created and we arranged them one by one. There is a called design business canvas method. By using this method, we adopted some of the solutions by talking with the residents and the community. And also we developed the app, so the online and offline are connected. And also we were applying the blockchain to make the energy coupon or the mileage service. All of them cannot be done by the leading of the government. Well, of course, there should be the policy research at the first stage, and then after that, we have to create the policy agendas. And then after that, designers, the government's experts, and the regulation, the law implementers, they are all working together to think about the public's goods, sustainability, profitability, and the expandability through the service design. Let's look at the social aspect.
Our technology is seeing a great advancement, and in this sense, what role can design play? We need to think about it a lot. In 2002, we had SARS, and in 2015, we had MERS. And in 2019, we are faced with COVID-19. These challenges, every time we face them, the social factor becomes greater at one point of the time. Then it comes down again, and it becomes forgotten. However, these design factors would like factors that sustains, that remains. Are you aware of this map? It's a map drawn by John Snow in United Kingdom. John Snow is a doctor in United Kingdom when the cholera broke out in UK, and he identified that it was around the water pumps in UK. Then can we see the map of COVID? It is based on the map using dynamic data in the digital visual system. So not only recognizing the issue or the problems, I believe that the design plays a great role in resolving the problems as well. This, I say, is a roundabout of design. Design goes to technology, it also goes to society. It can go in multi directions, for example, to the left, to the right, and we have the design playing the bridging role between the technology and the society. This shown here on the screen is a map of China. This is Wuhan of China. We can see the map on the left is January of 2020 and on the right is February. You can see it is very polluted in January, but after 1 month, the air pollution have been lifted. It only took 1 month, which at that point of the time, all the interactions in the earth has actually stopped. And because of that stall, the environment cleared out. During this situation, the people actually locked down in the housing and people started to open the windows and started to sing. And sometimes they use their cuisines or like frying pans and or so the cooking equipments to make sound and playing it like a musical instrument. So what can we think about this COVID? Did it only have the bad effects? It also saved the environment on the other perspective. We see that all these certified marks for our masks, KF94, KF80, and we also provided this Korean mask using this package design to distribute or provide these to the developing countries as well. And because the disposable masks also pollute the environment, we also created cotton-based masks as well. So this is actually not just a cotton mask, but it is also connected, linked to the application, therefore it collects the data and analyzes the current situation. So if it is connected to big data, I believe that it will be able to collect information on the air quality of the atmosphere and the status or the circumstances of it. And while here, Daegu was faced with a lot of difficulties. We had the mask aid, and also, as you can see here, of a app, it says Mind Map, My Family House, and Good Buddy. It is an example of the company that we have supported. And if you do, when you're out there in the workplace, we have like nurses and those carers who took care of the patients, dementia patients, that were faced with a lot of difficulties. So this was an app developed to help them out. Let me walk you through this app.
네.
This application was provided to the city of Daegu, and the social workers are actually making a good use of it. So for firefighters and the nurses would also be able to use this application as well. Have you heard of citizen design group? Well, what this refers to is that citizen, if identifies a social problem, designer resolves that problem. This is a network that we are currently conducting with MOIS. It has been ongoing and have collected more than 10,000 citizens' participation over the past 6 years, we're looking at more than 1,000 projects. I believe that would be very difficult if we didn't have any participation of the citizens, and we have various projects. As you can see here, this is a list of the projects that we conducted. And also, design identifies the social problems and also innovates the society by doing so. This is the design. We have this citizen design group, but also a company should be turned into a socially responsible company. Therefore, we initiated the social entrepreneurship, strengthening the social responsibility. This is an example of a company that I have nurtured and fostered for social responsibility. It is a company that sells solar panels. Here you can see here an example of the design, and I'm going to show you a short video clip of it.
Tanyo karamba school. Tanyo pamana school. Ibu ngajo karamba school. Tanyo nyoting jaja karamba jaga cang.
Ini yang paling ini gili mana ke?
Gili mana sih ini?
20 shillings.
Kerja jana ke jelas jelas sama.
Enggak pakai lo, jangan sah.
Bagus, besar ni.
This cow can make electricity using the solar energy, and it allows students to charge their portable power batteries while they're studying at the school. If a student can bring full of energy at the end of every school day, it will be a big contribution for their families and motivate parents to send their children to the school.
She accepts the child to go to school.
Oh, really? So you will allow
Kalau itu begini, yang mana mungkin, mungkin school.
Yes.
Tahu tu school ini kan orang tu. Baik, mama. Saya go to school.
Seren Yuman.
Somebody who has been educated, you will not only change your life, but even the life of the community.
What do you want to be?
Driver.
Sekalian. Polis.
Doctor. Who wants to be a pilot?
지금 중간에 나왔.
So if you see the video and in between we have a Korean person who is the CEO, if we see her as a woman in a society, would be deemed as vulnerables, but however, out there in Africa, she was able to brighten that area. And the methodology that was adapted there was service design methodology, which was able to win the hearts of those who reside in that area, and we will be able to bring success in this project. Korea Institution of Design Promotion leads the design in society values. So not only do we have the citizen design group and also promoting socially responsible companies, but also we strive to reach ethics and human rights management and coexistent cooperation and safety innovation. We are based in Seongnam, which is a little bit outside of Gyeonggi province. We also had a connection or network that connects the public institutions in Seongnam. And if they have any inquiries regarding the design, we would answer them. And if you see here on the screen on the right, is the various colors. And this color is actually a color code allocated for each team, for each institution to apply the service methodology to resolve the issues that each institution would have. Have you heard about this? There's a telepathy that really makes sense. In 2014, we had a mind design where they were able to do a brain check to see how it flows between the left and right brain. We took a Spanish person to deliver their thoughts to a French person, and this technology was completed. And what we do, one of the projects that we do is human factor intelligent design. What this is that there's an expert who has actually aged or become weak. We will lose those experts. So what we try to do is to maybe have a motion capture or using their brains to memorize their expertise. At times, we may have prosthesis or additional supporting equipments to memorize the movements, or we would have a supporting equipment on the leg to memorize the information of perhaps dance moves. So these kind of human intelligence that is related to human intelligence, recording that would be critical. So we wanted to make a policy and is operating and promoting is this. We have this various kind of projects and citizen participant design in somewhat way looks like a hive of a beehive. We have the queen bee and the working bees. However, it's not really a top-down structure. It is center-oriented and working together to form a network. What we see in the traditional measures is a more top-down, but in this participating design, we see that it's more center-oriented and spreading out from the hub and network with the outsides. There are various incidents, and we refer to it as the X incident, or rather X file. These are extreme incidents that we might be aware of, or at times that we don't know but we are aware of, but those that we do know but we are not aware of. But what we should be concerned is that what is difficult is that we do not what we know but has not been revealed makes us very unstable. So it requires data and it has various technology, and we need to come up with scenarios and regenerating technologies. And so in order to make this happen, we need a strategy. If we take this in design perspective, we see on the left is the society and the individuals, and actually the reality and the virtual. We can see the verticals and the horizontal lines here and allocating the factors that are related to that. If you see at the moment, it's more of an individual-oriented virtual, but rather at all times, it has to be connected to the internet, and it has to, if you're promoting more on the real side of it, that it has to be a more slow life and sustainable design. And if you're looking for a mix of society and virtual, that in that case, network is very critical. So what is required is empathy. How can we form this empathy? So in this perspective, the X-Files or the X-Events that we are unaware of in the future, what do we have to do? We have listed it out, and to see what solution methodologies, service methodologies should be applied. It could be an overlap to do a matching of it, and I believe this is one of the design methodologies as well. So we are living in a world where we're faced with challenges and we see resilience. What is resilience? And based on this resilience, we can broaden our scenario and to enhance the number of and broadening the scenarios that we can respond to, and I believe that it will increase our resilience. And I've mentioned this hive mind design, the beehive, likewise, that is connected based on the network, would be based on the relationship in your organization. What is stable? What is satisfaction? What is the rewards? That we can identify and define these factors. By doing so, we'll be able to identify the X-files and define them to resolve those issues. But if you see here on the screen that there are many companies, actually the companies here are the ones who create vaccines, and Chongdal is a company which provides the materials of the mask, and Market Curly is an online e-commerce platform providing groceries, and we have Zoom for the video conference. Samchali is a bicycle company that provided another method of transportation. These companies have actually acquired an opportunity out of this COVID situation. So for example, their sales doubled in figures, and these positive outcomes that they were able to enjoy out of the COVID situation. Likewise, I believe that we need to take this crisis and turn it into an opportunity. We talked about the HI, like human intelligence. We have the enhancement actually to strengthen our physical or the mentalness of it. And lastly, how can we enjoy it? How can we make it more enjoyable? If we think of these 3 E factors, efficiency, enhancement, equipment, I believe we'll be able to turn this crisis into an opportunity. Lastly, I'm going to talk about the design. How can we take UD as an opportunity? And I want to talk about the traditions and the innovations. We actually have a saying that in the difficult times, we look for the wisdoms from the past. In this perspective, we are looking at the past and seeing what we can take from there. In 1985, we had good design that was recognized. And in 2020, in a new form, we have actually launched, leading on to the traditions, this good design Korea. It is GD. GD can refer to green digital, which is the core factors here. The government is also promoting Design New Deal, Green New Deal, and this can be regarded as part of our GD business as well. Design Korea means that in design is taking the role of CS. Last year, it was about digital transformation, digital conversion. Now this year we're talking about data, actually depicting the data, design depicting the data. So we have design festivals as well. This is the logo that we have introduced this year. And around Design Korea, we had various events and a lot of collaboration, that this is not just, not collaboration space, and trying to deliver to the people that this is not just a business, but in the sense that we're designing the logos in Korea and for Design Korea to pursue. We have forwarding design to enhance to a government-oriented Korean institution of design promotion, but there are these changes that we face. So in this time of crisis, what do we have to do? We need to plan. This is this shows the 12 future design agendas that we have drafted. And actually, the Korean government embarked or announced to strive on an inclusive policy. Among those include job creation. Technology, is it a crisis or an opportunity? With technology, what we feel is that many jobs have been lost. In this perspective, how can we create new jobs? This is something that we need to think about. So by using design, we can have innovation, industrial innovation, organization, and society innovation. And by making these efforts, we can create jobs. And we have listed 5,400 jobs that could be possible. In this sense, what we did was that we worked together with the government and the organizations and the Ministry of Land and Transport and SMEs, Ministry of SMEs. And based on this, what we communicated with the government officials is that they have various needs in design in each institutions. They were looking for designers. So what we do is playing a bridging role in connecting the designers to the government ministries or divisions that require the need of designers. So what do we need? We need to evaluate the ability and the capacities of the designers. So what we do is a service experience design, and in November we just started the subscription via online. And if you are interested in this certification, please apply to the certification to become a service designer. You can be a proud certified service designer. We say that wisdoms bring out the bridges and fullness makes up walls. What our ancestors did was that they were able to build the bridges to take the crisis into an opportunity. And I believe the public data had played the role of bridge in the past. So based on this, using this digital davi.com, we are collecting a lot of contents, and using this .com as well, we're doing a detox AI chatbot, which allows us to receive questions and to give answers. So this shows you an archive of books and webs. Also, we have built a museum. And on the web, we have design archive of the past 50 years. In this perspective, how can we use this data? We need to use a platform, for example, design management or design strategy or government design management. And we're building one by one based on these 4. So what we ultimately want to achieve is data-oriented platform to connect and strive the ecosystem. And I believe this is required in this 4th industrialization in this untapped society. However, we're also faced with IP issues regarding on this own platform. So what the government does is to protect the rights by matching the designs. So we have the industrial design from the manufacturer innovation, which leads to the social innovation. From the left, we have the citizen participation design to the social economic advancement to the right. And likewise, design-centered these kind of policies with the participation of the citizens will be able to change our nation. We have citizens, the institutions, and the corporations, and the schools, the academia to all collaborate together in order to achieve success. We need to have the designers together to bring change to the society.
Thank you very much. The President Yoon gave a presentation. majority should be happy. That's the design's goal. So she cited this quotation, and then she started the presentation and what kind of designs are needed in each society. We could look into these, what kind of options we could have. And one thing interesting for me was to charge the phone from the solar panel in Africa. Well, actually, it was aiming to get electricity, but many children could go to school, and now it is becoming a generation of power to enlighten the future of Africa and create the social values, improving the quality of life, and enlightening the future of our lives. The 2020 Seoul Design International Forum is actually with a lot of people who are playing a bridging role. So let's move to the next one. Next is the social distancing experiment will be taken a look. The Dean, the Lancaster, prepared this presentation.
Hi there. My name is ㍍Fagan, and I'm the Head of Architecture at Lancaster University in the United Kingdom. I'm an architect and academic, having worked on a number of high-profile buildings, including as a lead architect at Zaha Hadid and as project architect for the London Olympic Village before starting my career in academia 10 years ago. Today, I want to speak to you about a research project that I've been working on. The project is called the Social Distance Lab, and it was a project we completed about 3 months ago. I will speak first about the concept of social distancing, go on to talk about signage, and then finish by talking about the research project itself. I'd like to start though with a quote from former Congressman Ted Kennedy, who said, "What divides us pales in comparison to what unites us." So, although today I'm technically going to be speaking about a research project that aims to separate people during the pandemic, my hope, or my dream rather, is that eventually the shared experience will activate communities and reignite a sense of social cohesion. So let's speak a little bit about social distancing and its effect on transmission. The majority of current scientific understanding refers to the importance of distance as a factor for reduction in the rate of respiratory cross-contamination between humans. Aerosol transmission through droplet expulsion by breathing, speaking and coughing means that people who are within 2 meters of the infected are susceptible to direct contamination through inhalation. As that distance decreases, the risk of contamination increases. What is clear, though, is that the incorporation of social distancing measures in nearly all countries has led to a direct reduction in the number of cases and deaths. In the countries shown here, after incorporation of such measures, indicated by the coloured bars, cases and deaths reduced, thus demonstrating that social distancing is really a key weapon in the fight against COVID-19 spread. And it's not just the cost to human lives. The significant economic effect of COVID has dealt a major blow to governments around the world. In the US, one study estimated that the implementation of social distancing would save the US economy something like $5.16 trillion. But one of the interesting outcomes for me of the pandemic has been the different scientific approaches to the metric of social distance that countries have adopted. So the UK and Canada started with 2 meters, the US began with 1.8, South Korea with 1.4, and China, France, and Hong Kong with just 1 meter. Now, these distances have changed, but it is interesting to observe the vastly different scientific interpretations of the same strain of flu. However, what each country has a shared understanding of, I think, is that social distances reduces the initial volume of patients in hospital and healthcare departments by flattening the curve of infections. So on to signage and the ways in which countries have tried to guide their citizens in social distancing. It's fair to say that early on in the pandemic, the approach was mixed. This is an example of an elevator in a shopping mall in Indonesia. I'm not quite sure what distancing this is observing. Others have been quite ingenious in their approach, using local resources at little or no extra cost. On the left, chalk circles in Nairobi, and on the right, chalk graffiti at a vegetable market in Chennai, India. Here we have lines scraped into the asphalt in Pakistan, and simple but effective painted white squares on the right. Moving west, an equally diverse approach to distancing saw an incredible surge in the sale of black and yellow industrial tape. The sign on the right in Brooklyn, US, appears almost angry in its tone, reminding people to keep their distance. Early on, some shops and stores designed on-brand signage, including the colour, font, and their brand identity, like Tesco stores in the UK on the left. But others adopted for a more ad hoc approach, using hastily printed A4 signs, for example, those taped onto the chairs as shown on the left in Thailand. The general consensus globally early on was make do with what we have, but make it work effectively. Design or aesthetic was, I think, simply not a major consideration early on. Which made me think, why are we pursuing all these different and disparate approaches globally when we are all facing the same issue? Is this a problem that could be solved using clever design? So I postulated 4 primary research questions. Number 1, can social distance guidelines and guidance be automated using computer systems and generative software algorithms? How does signage design affect people's responses to social distance measures? How does signage branding affect people's response to social distancing? And finally, can the outcome be achieved cost effectively? And this is where I came up with the idea to test all these questions in a live lab scenario. We would set up a test space for rapidly designed and installed signage that we would then invite people into to evaluate and collect data from. We called this the Lancaster Social Distance Lab. The research was funded as a very small part of the 13.2 million E3 UK Beyond Imagination project, which looks at the scaling of design excellence at Lancaster University. The clients were the local council, who were the owners of the building that we set up the lab in, and we employed a local design team called WASH to design the signage. We would then invite local Lancaster businesses into the lab so they could see examples of social distancing before they themselves reopened their own businesses. Much of the difficulty of the early design development for the project was meeting virtually at the very start of the pandemic. It was quite a novelty, in the UK anyway, to have a full design team meeting, designing collaboratively together on Microsoft Teams, an exercise we would almost always do face-to-face pre-pandemic. Just as some context to the location of the research project, this is Lancaster in the UK, about an hour's drive north of Manchester. The building we chose is right in the middle of Lancaster City, so we could ensure good footfall and easy access for the test space. And this is the building, a multifunctional building that houses offices, a cafe, businesses, conference facilities, dance hall, lecture theatre, right in the centre of Lancaster. And so it was an ideal building to test quite a complex arrangement of interrelated rooms. And the plan illustrates this well, I think, and shows the mixture of rooms and the complexity of circulation. A photo of one of the room's interiors. And this gives you an idea of the ornamental staircase and the wall panel detailing. So onto the testing and the evaluation stage. The first stage was to understand how to even begin to approach this new signage typology. We needed to understand what people thought of different types of branding or tones of voice. We showed the participants a number of different images of different types of designs which were branded in different ways. This slide shows universal or off-the-shelf style signage, and just 63% of those we asked thought this was effective. Onto government UK branded signage, even less thought this was effective, with some stating they thought it was too aggressive or forceful. Then on to local council branded signage with colour and logos of the local governing council. Just 65% thought this was effective. The store-specific language was the least effective, as many thought the signage just disappeared into the background too easily and would be ignored. Finally, the most effective signage at 72% effective was designer bespoke. People thought that the new pandemic deserved a new approach to signage, one that didn't need to respond to any existing brand or style. To them, this was a new problem, so it required a new solution. So we started from first principles. The colour palette we used was based on the psychology of warmth, safety, confidence and calm, because we thought this was important. The font, simple Arial, was big, bold and clear. We knew that most of the population had experience of road and pedestrian signage and decided that the format of road signs with their shapes for message, instruction and direction suited this new language of signage, so it wasn't entirely unfamiliar. Hence we set up a simple principle of shapes associated with type of sign. So circle, a message giving advice, for example, keep your distance. A hexagon, an instruction, for example, no entry. And an arrow, a direction, for example, go this way. Which is how we developed the signs. And a series of client and team reviews further resolved the different types. These are the signs for the flooring. And so on to the next stage of design, where to locate the signage in relation to the existing plans. Throughout my career, I have used generative software to provide optimization of patterns. I decided to build upon an existing project that I was working on that was looking into retail saleable floor efficiencies using parametric or generative software. As you can see here, I'm using a piece of software called Rhino on the left and a parametric software called Grasshopper on the right. On the right you can see the rather complex algorithm that I wrote, allowing automatic alterations of floor plan designs to test through an optimization algorithm what the most efficient width, length, depth and orientation of retail display is to provide optimal sale per meter squared. Using these precisely same principles, I updated this algorithm to generate floor plans to design social distance floor plans for any layout and any metric which would provide the most efficient use of space, i.e. the best or the highest number of people, chairs and tables per meter squared, which is what we did. And this is the raw output from that algorithm. An AutoCAD drawing showing circles for the location of chairs in the cafe at the Story building. The white, larger circles indicate the social distance offset from the individual, and the yellow lines indicate the bubbles within which individuals can sit safely. And so after the design was generated by the algorithm, onto the printing, fabrication and installation, or the fun bit as I like to call it. So we used vinyl for both the wall and the floor signage, and we were careful to accurately position the signage. And in the end, I think we achieved a rather dynamic new typology for signage, which is clear, bold, but comforting and reassuring in its messaging. And when we opened the Social Distance Lab, there was a lot of interest from local business, and we were busy for the week that we opened. And many of the business owners were yet to open their own buildings, and when they visited, they found the lab useful to view a space that had a clear and distinct signage. Out of those that visited us, 91% believed that signage was important to reduce the risk of infection. 93% thought the signage was effective at the lab. 86% thought the customer or user has responsibility for social distancing. And 10% fewer, 76%, thought that the custodian or the building owner has some responsibility for social distancing. In terms of costs, materials were approximately $8 per meter squared, but we believe that the cost can be further reduced by opting for a less expensive printing technique and a backing that we used. We also believe it's important to produce this research for the good of our communities, and so we've made all the signage free to download through an open source signage pack, and these are available free to download from our website. The pack has a wide range of options and potential for customization in size and shape. Here are some more examples. And so on to impact and evaluation. What made me really proud of the project was beginning to see these signs popping up in and around Lancaster. Here in a local office. Here along stairs and above entrances. And it was good to see the research having practical use, helping people reduce their own risk of infection. And there are further applications. The Lancaster University Health Innovation Campus, for example, wish for it to be installed. And here are just some images of what that might look like. And finally, on to the next step, so the scaling of the project. We've now applied for UKRI funding to scale up the research to UK-wide using a cloud computing service called ShapeDiver. And we intend to create an online portal that anyone can access. So instead of altering wheel rims using grasshopper algorithms, as I'm showing here, we intend instead to upload our social distance algorithm to allow users and building owners, who could be hospitals, schools, care homes, businesses, to instantly generate social distancing floor plans in this same portal, and signage as well to provide them with an optimized layout. We hope this will deliver savings of millions to the UK economy through the agile rearrangement of buildings, avoiding abortive design by the thousands of existing disparate design approaches trying to achieve the same outcome, a safe and rapid reopening. And so, on to the conclusion. I think the research project, although very short, has delivered proof of concept and has been successful in answering the research questions. In future, I think that over time, signage will become less important to citizens who will learn simply by repetition and memory to keep a respectful distance without having a constant reminder through this signage. I think that although most of us yearn to be together, we will begin to understand as a society that the physical distance between us should not define our empathy or humanity in communities. Rather, it should embolden us to feel closer than ever before. We have experienced a lot together in this last year, you and I, and we need to continue to help each other. Which brings me back to my first quote, and I hope you understand a little bit more the reason why I included it. What divides us pales into comparison with what unites us. Thank you.
Thank you, ㍍Fagan from Lancaster University, who is the head of architecture. Generative social distance design, the optimization of building layouts of COVID-19. We were able to see the details of the signage and how to reduce the infection and seeing the effective signages. Well, he actually said that the signs will no longer be needed. However, I hope that with the dissemination of those signage, also we will lose the social distancing as well. We are continuing with the second session of day 2 regarding crisis response design. We would now like to invite Chunho Shim of ㅍSafe CEO. His subject is regarding designing safety content that you want to keep it on your desk. Thank you.
예, 안녕하세요.
Good afternoon. I'm Shinjunu. I'm running the Safety Design Research Institute. First of all, I would like to extend my gratitude to give this honor, to have this honor to speak at this stage. I was kind of like wondering, well, can I say any word at this prestigious event? So I was really wondering what I should share here. So I was just thinking that maybe it would be good for you to think that there is a research institute who is considering the safety concept like this. So ㅍSafe is a research institute making a design for the safety. So we are making new safety rules in a fun way. Sometimes it's very essential and sometimes it's very fun. So we made kind of like infographic about the safety, and we are creating new design to introduce and explain the safety rules. Safety Experts are interviewed, and we are trying to listen to the voices from the field. So the safety guidelines, infographic, and experts interview. And safety issues are actually published as a magazine for the safety and every 2 months. And if you need any, you can have it because it is free of charge. It was established in 2014, and actually we were just making the safety manual and sharing those. But since 2016 we began to publish these magazines, and now we are collaborating with various institutions to work with our children, and we are providing the safety campaign with them. And also internally, we are making like safety related contents. We are sometimes creating the new character to apply these. And also I attached these posters on the wall of the Hongik University. Of course, those were removed after the election. It's kind of like the patch for the safety. It was one of the result that we want to make any kind of like the medium to promote the importance of safety. OSAFE is working like this because I really want everybody can live long life. And as a designer myself, I would like to say why we OSAFE is doing these activities and how we are making on safety related contents, and the processes will be shared here. Do you take out the unused cable from the outlet? My father used to say that I can stand that you are not good at studying, but I should scold you if you don't take out the unused plug. He was actually worried about fire. After making the safety design studio, I used to work with my clients. But on the other hand, I was thinking, what can I do as a designer working for the public good projects? And I chose safety as my theme after watching the disastrous event in the Daegu, the subway fire. And that was kind of a personal motive, and also thought I could also find that there was very little references about the safety design. As designers, what we can do is to visualize something are invisible and creating something new by reinterpreting the existing ones. Some are not getting any attention. Maybe it's not fun, or maybe we are so used to it, so we try to make a new design to explain the safety. What do you think this is? Well, this couple are having like beef. And then what happened? Can you tell what it is? You see, the grill is actually bigger in size than that of the burner. So you have to guess what the situation is by looking at closely. So, well, in this way, we were trying to seek for fun while promoting the safety. Fun and emotion, these are actually not curriculable. Rather than meeting everyone's fun, we wanted to produce the suitable contents to promote these kind of rules. After eating something, if you are going into the water, then it's very dangerous. So I wanted to express that concept. Like this, I wanted to redesign and remake a new content that everyone actually knew, but you have to rethink to promote safety. This is it. You have to live long to see this like this. So we wanted to make kind of like a brand of a safety manual. After a while, I began to think that the safety manual is our best, and I thought maybe no, we can do more than this. Well, we cannot make a unilateral solution for every situation because the targets or the victims and situations are totally different from one to the other. So rather than just providing the uniform solutions, we wanted to find out better measures so that the victims or the people in the situation can judge the situation objectively and to deal with it in a better way. So we put design at the center, and we made the safety manual in a fun way. So we added more contents of safety related matters, and we also added interview with experts, infographic, and other the meaningful events or the contents in the magazine, so that we wanted to increase the awareness of the people related to the safety. After the safety making process, we have a very unique stage to make a failure scenario. So we wrote the situation and project related the parties, similar cases, and surveys. After collecting this information, we selected some factors which can be led to the failure, and actually there were various reasons that safety contents could not get popular. But, well, maybe lack of budget, lack of marketing, or the external environment. Those were the factors, but most of those people were not interested in safety-related contents. How come? First of all, I think there are three reasons, but first one is it's not fun. Putting aside the safety-related information, there are already so many fun contents like mukbang, like eating, broadcasting, the camping, and other fun shows. In our daily lives, we think the safety accidents are not related to others. We are not interested, and we're not paying that much attention. Lastly, maybe if you are too keen on to this kind of safety information, maybe you're obsessed with it, you can feel it in that way. So naturally people are trying, or the people tend to avoid this kind of warning information. So we wanted to set certain level so that people could feel that the safety information is kind of fun. And so we made guidelines, and there are three of them. The first one is the safety contents guidelines. We actually used characters such as pets, like cats and dogs, or the property related matters were also covered while embracing this kind of safety. So in this way, we extended the ways to promote the safety rules. Like the situation when you can face when you're on board of the ships, we wanted to express the warning very clearly, and we could prevent this. Good tips before getting on the fleets or before hiking, you have to work out for the readiness. And also for the third item, we had to set the level of the safety guidelines. So we looked at already published design contents, and also we looked in our content, and then we evaluated how they work, arranged, and also we listened to the voices of the institutions who are actually disseminating these brochures, and also we listened to some of these experts' tips. Based on these three, we made a concept if, and we made the safety-related animation was made. And let's watch one of those clips.
가족들과 함께 보내는 최고의 주말은 캠핑만 한 게 없지. 캠핑의 꽃은 역시 대낮부터 때려주는 불멍이지. 아이 좋아. 아장아장 아장아장. 아 아트라 거기 누구 없어? 아이가 불에 되었어. 어서 아이의 손을 얼음이 가득 담긴 아이스박스에 넣어요. 응급처치에 필요한 화상연고가 있어요. 얼른 상처 부위에 발라요. 흐르는 물에 부어서 열을 식히는 동시에 깨끗이 해야 돼. 난 이렇게 생각해. 우선 너무 차갑지도 수압이 세지도 않은 물에 흐르는 곳에 화상을 입은 부위를 10분 내외로 담가 놓는 게 좋아. 가까운 병원이 있고 교통편이 용이하다면 응급처치를 하면서 이동하고 여의치 않다면 119의 도움을 받아야 해. 아이쿠, 응급처치보다 중요한 건 예방이지. 오늘도 안전한 하루가 되길.
So what do we think, so to induce the appropriate behaviors that we think is right and also to ensure safety, we use the visual manuals and a different form of magazine, the contents that is in a different form. In 2009's social designer Yum Ji-hong has actually started on this yellow card to secure transportation safety and work together with OSAFE, and we actually was in line with the concept and the line. So we're working together with institutions, the schools, and other companies to work on this, to collaborate and work on this yellow card project. The campaign itself is regarded as a soccer field, so the children are the referees. So they're looking at by giving them the opportunity to become the referee with the yellow card to make sure and ensure that the transportation, the vehicles are making the appropriate signs and are taking good care of the lights. So by doing so, the children can take passively or actively take in the information and make decisions based on that. And with the teachers and parents, in addition to not only by sharing the sole function of it, but also the adults who are driving may not be able to prevent incidental accidents. We wanted to bring an opportunity to prevent such kind of incidents. OSAFE YouTube, you can watch the full video clip of yellow card to ensure children's safety on OSAFE YouTube. Manner makes people. Every time that we have different standards for manners that are different for each people. We have manner project called ING. Using characters, we share the stories using very fun characters. This could be actually inconvenient, or ing, which is kind of an expression that we say when in awkward cases. It just does not stand for just a one-time expression. It has various values or meanings behind that. This project itself has this manners, these bad manners that happen across the public spaces, and to correcting and recommending good manners on the other side of that. With our citizenship, we want to be aligned with the social framework. We have with the widened social activities for the 20s, and it shows the stories of their own stories and also delivering their messages of the 20s. We need the places where requires manners. There's no time or no human or no place that requires manners. So by doing this project, we were able to provide an opportunity to inform people of good manners, and I hope this could be understood and communicated clearly throughout the whole audience. In design methodology, there are various ways of method and approach. Mostly, what methodology is applied is to identify the problem and the method that or the path that we need to take to resolve this issue, finding the most efficient way. Regarding safety, the safety sector is the actual basic rights that we have and also a critical factor in forming a happy life. However, after you have graduated from kindergarten or elementary school, that you no longer have training on this once you become a grown-up. So you need to think about what is required to have a appropriate safety culture and what actually people require to have on a regular basis, some form of training or some form of communication to ensure that people are aware of the safety contents. This is something that we need to be remembered of or keep in mind of on a daily basis. So this is an example of a goods that was produced by OSAFE, wishing good luck. It's a good luck charm for the people, and this is wishing you to prevent shopping spree. It's a shopping charm. Also, OSAFE has been attempting with the goods to be used in everyday lives because this is something that people could have on their side with the message delivered as well. And also, this goods is to provide or to think about if we are considering the users and what kind of various attempts that we have. This is the process that we are taking on. As a sustainable activity, we are embarking on collaborations and projects with other people. The safety design is a comprehensive consulting sector. It is not just simply focusing on the consequences or making outcomes. We want to discuss with the stakeholders the expertise and the design methodology to depict a process of how a decision making is done. These tangible outcomes is just a part of this whole process. So what people want is more attractive and despite in this busy schedule because they have very limited time and live in a busy life that they have so much to do but they have so little time. So the contents that we make, we want to make something that is visible to the people, that is fun, also forming empathy. With that mission, we want to earn the attractions by the citizens in the form of collaboration according to the theme of the magazine that we issue. Depending on the infrastructure or the budget, we are subsidized for that, and we share the information and we process them. As you can see here, this yellow card campaign to protect the children's safety, we operate based on who the target is and in which area it is distributed. Regarding collaboration and responding, we have a daily basis meeting client with limited resources. We need to come up with outcomes. Therefore, an efficient process is very critical in problem solving. We have various resolutions that we can take, but also in the same line, on the same page, we need to discuss what kind of various approaches we can take. Looking at the process and discussing about it, we need to review the objective of the process and also cross-check what we are good at to make sure that we can distribute the work. Regarding safety for the Children's Safety Institution, we also provided the design or the message delivering the safety information. At the time, currently, there are so many safety-related messages that one could take. However, I don't think there is never a flood of safety-related information because you also need to satisfy access as well. So if you look at the safe design that I started since 2014 until 2020, I, as a person or a citizen, what I wanted to do is to produce a safety content in line with the government and the relevant institutions, and I think we have achieved great strides of advancement. I believe that ㆍSafe still has room for improvement, but we are archiving our safety design contents one by one. There are various projects that you can go online to check our contents. So this is the last part of the presentation that I have prepared for today. To give you the summary of what I have spoke to you, the safety contents require understanding of the users, and in line with the trend changes, it needs to cope with to provide an efficient and a fun way of delivering the message. And by doing so with these continuous activities, the knowledge would be awareness, and awareness will lead to actions which we can step up to the safety society. We may take different methodologies, but we all are aware that we're directed to safety. Therefore, ㆍSafe will strive to provide safety contents which will be helpful to our society. Make sure that you unplug your contents that they are not in use. And this is a safety content, designing safety contents that you want to put it on your desk. This is the end. Thank you for listening to me.
Thank you very much for your presentation. It was a fun story. That the CEO, the ㆍSafe Shinjunu of the Safety Design Research Institute, it was the same theme, but by using the different design, the outcome was totally different. So that was told here, and the goods were very fun, and I really liked it. And I never thought that I should give the safety-related goods as a present to others, but I really felt that this is like the one that I want to buy and give someone else, and really you post it on your desk. So I hope that more fun and interesting the safety-related contents could be made so that everybody can live in a safe world. And we are in the session 2, and the crisis response design, and we have the last speaker for the session 2, and we have an application which is actually revealing the information of the COVID-19 confirmed cases. I think many of you used this app, and this is the youngest speaker among the speakers today, and second grader of Korea University, and the name of the speaker is Chejun. Respond to the crisis, it's the title. So from observation to execution, the corona whereby is the topic today. Good afternoon. Corona whereby. I'm the Industrial Information Department school student of Korea University, and my name is Chejun. I'd like to share my the experience of developing this application, and also I would like to match the design aspects to this. And this is the contents. So this is the background of the development purpose, and with what purpose I tried to make this application, and during the development process what kind of ups and downs we had, and I would like to share the insights I found during the process. Well, I tried to think about making this application in the very early stage of the corona outbreak. My team members are actually the students learned about coding, and some of them were actually involved in the startups, and they were making the applications. And I was
also working as designer and then app developer at the same time, and we were trying to make a service. And there were some like a group chat room and the designers community, and they were running a startup, and then they were talking about the corona, the spread map, and we saw the site, and by looking into this site, maybe we can apply our technologies that we studied, and then, well, we started to develop the apps by staying overnight. What if we make a service to introduce the location of the confirmed? But already there were several services who were giving information on this. So if we make the same thing, then it's not a new one. So we just thought that what's the current services problem and how can we improve those difficulties? And not only just by improving the difficulties, but maybe we can do more than that. What will be the differences from the existing services? And we went through a process to set the core value of the service. By doing so, well, we could identify what's the weak points about the confirmed location services. Well, previously they had to connect the dots of the spaces where the confirmed visited, and they were actually giving the real-time information like light signage that where people were visited by the confirmed. And then I just began to wonder, maybe some of those users will wonder what's the risk in the region where nobody visited. In this COVID-19 era, I thought that maybe the personal matters would be also kind of like concern. So we thought that maybe just rather than providing the overall information, maybe our focus should be the individual, the interest. So we made this hypothesis and we observed how users are using this service. By observing this current status, we could see that many users actually wanted to know that if my area is safe to live in or to visit. And I thought that maybe many of the users wanted to know that the nearby safe places or the dangerous places rather than the whole nations, the risky places. So maybe you can just think of the concept that like it's kind of map to identify your location, or if you have any destination that you want to visit and then you want to find out the safety related information in that region. So I just thought that what kind of like additional information we could provide related to the locations visited by the confirmed. So we went through the brainstorming rather than just like lining up of those like needed items. And we thought we could find that the test and identifying the symptoms are important to prevent the spread of COVID-19. So when we thought about these important factors, then we could think that, well, maybe people needed the information on the pre-screening clinics so that we could get tested if we needed. And the Korea Disease Control Agency were actually providing the lining information. And I thought, well, these lines are not easy service for our users, and if we visualize these, then it'll be better. So I just set a setting that I could find my location or the destinations information related to COVID-19, and we provided the screening clinic locations and also the regions visited by the confirmed. So after this, we bought the domain, the coronaware by, and that by doing so we could provide the information about my location and the COVID-19 related information.
So this is the service, this screen. You can just search where you want to go, or you can just search where you are and the COVID-19 related information. Maybe the information on here was not that a lot of like varieties, but we embraced the core information in this app, and we are very proud of ourselves. And that would, well, actually in the beginning stage, the map routing the velocity or the information we could embrace or the UI, all those things were different. But by listening to voices from like my the colleagues or friends, we could get feedback, and then we could find the bugs or other ideas which can be reflected for the development of this application. And after this testing, I thought it was stable, and then we launched this. Actually, it was a side project, and we were not thinking about like generating profit, and there was no ad, and there was no marketing. We just uploaded one posting on the community website, but well, actually it was on one of the lists of the keywords on the website. So it was a kind of like a viral marketing success story maybe. So within a few days, 5 million near visitors visited this website. Do you remember the 31st, the super contaminated confirmed the patient? Well, after that, the changes had changed totally. So I will elaborate the difficulties later on. So before the third one, before the 31st, there were only like 10 or less than confirmed. But after the number 13, well, there were like hundreds of places where the confirmed visited, and already in the Republic of Korea, the quarantine system was already done, and well, it was already like quarantined, and then well, you could just go to place because it was safe. But still, those information were released, and then the owners of the stores had to face some damages because people did not want to visit the same place. So well, we wanted to avoid remove this kind of difficulty from the owners, and then well, we were not thinking about generating profits. Actually, I just thought like, well, maybe only like the colleagues or the acquaintances would use this app, but more and more people were using this, and we could not close our eyes on the fact that the unresponsible people, the people who are not related to this kind of contamination, had to face this kind of difficulties. So we had to go back to the starting point. Then, in relation to the spread of the COVID-19, well, I could find some cases that, well, I didn't wear my mask, and then I had to go to the convenience store to buy it, but there was no mask. So those cases were reported. And there were some voices that like, I forgot to wear my mask and it was so inconvenient, and I felt guilty like that, and there were no enough number of masks in the convenience store. So well, some had enough many masks, but the others, they didn't have any, and they were just like sold out. So in real time, we launched like the mask inventory service real time, because we did not have like enough masks. So we made a new app named like Mask Nearby. So this is the screenshot of the application, and we wanted to spread information in real time where you could buy the mask in the convenience store. Well, this one actually was hailed by the users more than the COVID-19 nearby, and then more than 20 billion users visited this website, and also those convenience stores which were having the corona masks
well, they could see the sales in selling those masks, and also we could see that a lot of users were using these services even though like all masks were sold out after this. So after our service was launched, there was the advice by the president to create a mask inventory app, and we were informed that the data would be provided by OpenAIP. So by doing so, we'll be able to check the status of the public provided inventory of the masks. So with the development of this application, we faced some difficulties. Of these difficulties that we faced, we actually just categorize it to two regarding technical difficulties and the social difficulties. The technical difficulties will be regarding the data that we need to collect, and the social difficulties would be the people that we deal with. Actually, when we first started with the COVID-19 alerts, it also faced with difficulties due to the data, because at that point of the time in the very beginning that we didn't have the wholesome of the holistic or the comprehensive data, because if the path was within the patient, if the path of the patients was within like Seongnam or Gangnam, we had to go to every website of each district to collect that data. It was actually dispersed everywhere, and there was no one streamlined system. And after super spread, it was difficult for us to actually collect all the comprehensive data all at once. However, also we thought that while we were collecting this data, these difficulties that we had, that we need to think about a different approach. And the data that was provided by the government itself, it was a holistic data. However, it was in a text form. So rather than it is referred to as a technical difficulties, but it depends on how the form that it was provided. I believe that now I'm going to move on to the difficulties of the society, that perhaps when we do a project that we do on our own, and actually after seeing the users who uses our services and those from the services that we are putting influences, that we felt responsible for the service that we made. So now we only provide the services to fulfill those who use, but also we saw the damages that could have been caused by the service that we provided. We only thought about the users who we wanted to satisfy, but also it was a wake-up call for us to think about those on the other side as well. We actually went through a lot of difficulties, and we went through trials and errors all throughout the year. There were the benefits and the advantages that we thought about, but we also wanted to listen and apply the feedbacks by the users as well. What I thought was that I could not satisfy everyone. However, if I observe and with the updates, with the feedbacks, that even though we might not be able to satisfy everyone, but maybe we'll be able to satisfy those who want it. Likewise, it is trying to collect as much as apples as much as possible. We don't need to overfill the basket, but we also do not need to not fill the basket up as well. So looking at this minimal social issues and also trying to identify the cause and trying to find resolutions, I think it was a great opportunity for us to discover those efforts. Thank you for listening to my presentation. We have invited developer Choi-Jo-won, who has shared with us about the response to the crisis COVID-19 alert, who has developed the application, and based on the challenges that he faced, the actual detailed sharing of the experience that he went through in this COVID-19 situation. I think we were able to respond quickly to the crisis because he really thought about what the needs of the users were, and also these inconveniences that he had in everyday life, and he actually took that as a stepping stone to build it into an application and to realizing it. And I thought that was a great insight that I can learn from his presentation. Also, the two-sided feel the two folds of the application where it may provide benefits to some but also damage some users as well. We are now in the second day of 2020 Seoul Design International Forum on Design for Social Resilience in the post-COVID-19. Now I'd like to wrap up the session 2 on crisis response design and move on to session 3, Design for Era of No Face-to-Face. First of all, I'd like to invite Toshima Kenta from the University of Tokyo project. Nice to meet with you. This is Kenta Toshima. I'm very happy to present this event. Thank you very much. I will speak for 25 minutes with the title like this. First, let me introduce myself. My name is Kenta Toshima. I'm currently 34 years old and I was born in Yokohama, Japan. At Tokyo University's Advanced Science and Technology Research Center, I studied the virtual reality effects on the elderly. And currently, I'm working as a university employee, but I was a nursing care worker at a nursing facility. There were a lot of people with disabilities and the elderly. And, okay. Currently, and there were a lot of people with disabilities and the elderly, but there were many people who could not go out or travel alone. Since 2014, we have been providing travel experience services using virtual reality because we wanted to somehow fulfill their wishes. And there's a brief summary of activities, so please take a look. So, many people come with cane like this. Many people had an unstable lower body and are actively doing strengthen training and balance training. We'll take a 360-degree camera to take those places they wanted to go. So in this way, we took 360-degree cameras to the places they wanted to go once more in their lives and show the content we created after shooting. Like this, well, they were very happy and walking and moving around. They were really having fun, looking upside and down. So it's like putting a camera that they wanted to visit or they visited before. So through these kind of activities, the virtual reality had a very big potential in this kind of like nursing facility. So like reinvigorate our seniors and providing the motifs for the rehabilitation. Using the VR, they could experience like in high quality and they could have fun. And also I want to see, well, actually in that sense of like meeting their needs, there was a high potential. Well, on the other side of these activities, there are challenges, and one of them is that we need a lot of sources taken like 360. And well, after interviewing the people who were having like moving difficulties, and I took camera and took up their photos and showing the virtual reality. I was doing this myself, but there were some limits. So how to solve this problem? And then I could participate in a very interesting activity. There was senior iPad classroom. It was very interesting because not like a young teacher was teaching the seniors how to use iPad or digital devices. Teachers were seniors, learners were seniors, so seniors were teaching seniors. Like this. So they were all seniors, so even though these questions were repeated again and again, because they know why they are asking the same questions, so they could understand each other. More than that, all of them were really enjoying the fact that they were teaching and learning the digital devices each other. By looking at that, I just thought that maybe I can give my some of the tasks to that. So I made a community. They could record it and we could make a VR community. And the biggest goal is that the lifelong learning, we were supporting the participation in the society using the VR. The targets are active seniors who are still healthy, not using the nursing service. From 61 years old, and the oldest one is 93 years old. And the service was initiated in 2017. And we hosted workshops so far, and for a total 50 members participated in. At this moment, 11 members are actively participating in this campaign. So the 360 shooting, the editing, all those the work process to show these clips after editing is taught to seniors. By running this community, the most listened the questions I heard, the frequent questions was that for seniors, what kind of devices are used to learn about this shooting and recording and editing? First one is that the 360-degree camera. At this moment, I'm using the Insta 360 degrees, and it's a very small scale of camera, like your palm size. It's very easy to carry. And also it has a function to kind of the adjusting the shaking when you take the video clips. And to edit the raw clips, we use iPhone. So we sometimes used the triples, monopods, and we are trying to reduce the weight of the burden. So active seniors are enjoying that the virtual reality made using the records. And then we use the Oculus Go, the head motion devices. There are several devices, but the most important thing is actually make a uniform device. 50 participants are joining in this community. If they are using different devices and then the usage method are different, so the 360 camera smartphone, the head mounted display, all of them should be used the same thing. If you have any question, if you want to know more, because seniors are teaching seniors, well, this part is also important to tackle the challenge. Not only that, the online community's role is also important. In this era of the corona, facing to face is difficult, so we could make a Facebook group and we could have a meeting every day online. And from a travel place, you could take a video shoot and then you can just upload it from the field. Some are leaving reply, or you press the like button, and also the online they are exchanging actively. Not only just enjoying the shooting and recording these things, it's also used to encourage the social participation by seniors. This is one of those the things that were used, the Japan's the future, the exhibition. So the permanent exhibitions were removed, and well, before removing all the objects, the seniors could help the taking photos of all those objects, not only just making a record of these objects, but from the point of the participants, they could hear the story of the docent. And not only looking at those objects, they could hear the docent's explanation, and we could help that aspect because it was also important.
So these are the same spots, but different person took different point. On the left side, it was taken by an active senior. So he's just walking around and he can do most of those activities. And you see the docent is explaining the activity. And at the bottom, actually you were recording that you were listening to it. But on the right side, moving the clip, actually it was taken by someone who is on the wheelchair. So in this way, even though they are at the same site and the same situation, they have different angles to look at the docents, and they could see different sites. So we could share this fact with the museum. So actually we are asking a favor to the active seniors who are taking part in the recording with this camera. The most important thing is that the height of the location of the camera, because it ultimately had this mounted display. So if the camera is too high or too low, then it's difficult to concentrate. So based on the literatures, the standard is 150 centimeter to shoot the targets. And if you cannot use the tripod, and then you could use the monopod to take a photo or the recorded. Active seniors social participation could be done by in the Tokyo, this Shibuya. And for 3 months, active seniors could join in the VR recording planning, and this could be done in the daily lives.
So this is Shibuya. Considering the regional characteristics, we thought about what activities can bring that up in 1964. In 2020, we had the Tokyo Olympic that was planned, and we wanted to have a virtual reality content to kind of cross between these two periods. So first, look at the vision of how it was before. The video of 1964, because we didn't have a 360 degrees virtual reality at that time, we used the active seniors' photographs and magazines, the materials that they had at home. So looking back at their old times, now we switched to the current streets of Tokyo in 2020. Likewise, we were able to cross the 1964 Olympics and 2020 Olympics and create a video content and showed it in a caring facility. And active seniors and those who are having difficulties with the movement, it was quite interesting to see that everyone was enjoying this video so much. They're active seniors and those who are not easy to move. They have been it felt to them like traveling to the past, and we are filming and making videos of it to share it with them. However, in 20-30 years, they may not be able to move freely. So in that sense, filming videos at this point is something that they can enjoy in 20-30 years and something that they can vitalize their life, this virtual reality videos. And amid that, we were faced with COVID-19. COVID-19 has posed a great damage to our community as well, especially with the activities and sports activities. We saw a severe reduction in 2020 April, and compared to 2019 April, the average number of steps, when we had a comparison, it dropped by 31%. So it's not just the sports activities that has reduced, but those enthusiastic seniors, because they weren't able to go outside, were being stressed. If we were not able to have a face-to-face workshops, we wanted to open an online workshop for them. And we were able to discuss about the current trends and their everyday life patterns. So at times we use the virtual reality to take some trips, like travel experiences at home and in caring facilities. Also, we use this virtual SNS called CG space to freely use the functions for traveling. Because we don't have time, that they were able to use it at home to have the virtual traveling experience. So I'm going to introduce to you that the system we used was VR Sync. Remotely, you're controlling the virtual reality video content. Because everyone is on their own home, multiple users can log on at the same time to view the videos. On the systematic side, the seniors that have seen, they used to film the video contents and they were able to upload it, and they can download it and experience it at a set workshop or dates at the same time. And this VR video experience actually is divided into a download type and a streaming type. VR video uses the data, and because of its large volume, if you cannot stream it, you can use, depending on the internet environment of your house, you can use the 360 degrees and download it. So that is why we have this VR sync system, that it is uploaded in advance and individuals can download it in steps. The VR sync does not only provide the video experience, but also can provide communication, could not provide communication, so we use platform Zoom to sync the voice to do the communication. So I have this virtual contents that I can organize to play, to stop, or to skip or play the next video. And in the Zoom screen, what the participants could do is that their movements, and based on the communication that they do, I change the video contents based on that. Another thing I want to introduce to you is the virtual SNS service. It's not a real time, it is a CG space that that person can freely roam around and experience. During the before COVID-19, we actually had activities conducted in Shibuya, and because after COVID-19, people were not able to step outside of their homes, that we used this virtual Shibuya context to freely walk around the streets of Shibuya Center. And this virtual SNS, we could not have a voice communication. Therefore, previously mentioned systems, likewise, we had the virtual SNS, we use smartphones or tablets. With Zoom, it cannot sync with the other voicing devices. So for Zoom, we had two devices used at the same time. We actually have various different kinds of interesting responses from the seniors who had experienced this. They said that because they were so tense that they felt fatigue, or for those who were on a wheelchair, even though it was virtual SNS and VR, they had the avatars firmly roaming around and felt good because they're walking in the virtual space. And also they were able to run backwards, and these positive opinions were shared. In this virtual SNS, it kind of looks like a game in a sort, but rather than it is like playing a game, it is a tool of communication, and I was very happy to see the senior citizens using this platform. And through these kind of activities, seniors VR expansion requires a lot of assignments as well. Because VR, it hasn't been introduced for a long time, and it's quite new technology. In order for seniors to use it, we need to train them according to their understanding levels. Also, the senior generation has to understand the training systems, so we need to think about how to train them in the application development, and also to be allowing the seniors to make or create the VRs and to enjoy them. In post-COVID era, the social resolutions and the design that a designer should take, what stance should be taken in this respect. This is the question that I was raised to. I think it was actually a very difficult question to answer because I'm not a designer. I didn't really study design. So when the seniors are using the VR, I want to share with you what recommendations or what solutions, additions that was required for that sense. So actually I was handling VR, and I think it's the same for any other technologies. In care facilities, the seniors have to use these, and especially the seniors who have been using or spending most of their time based on analog tools. Therefore, this digital or the high-tech devices, they were not very comfortable in using them. They said that I don't have to use this. There were some resistance in some senior citizens as well. So for those who resisted, I showed them this VR, and they wanted to try it. And what is important here is that the senior citizens and the caring facilities, we need to stand in their level. So we need to be aligned to their level. And depending on that, we will be able to win their acceptance. For example, the recent VR goggle that we wanted them to try out, there are people who didn't want to try it. Then they would try the VR experience on smartphones. This is rather than a square or cardboard type that we're using. So in care facilities or rehab, those programs there are programs that people can use their fingertips, which they are actually quite used to in making something with their fingers, using their hands. For example, they first need to establish or make this cardboard. It takes about 15-20 minutes to make them, and they ask the question, how do I use it? Then I tell them this is for a VR and give them a smartphone. Then we will recommend them to try this VR experience. We don't give them the VR goggle in the first place. Those who did not want to use that, actually after going through this analog activity of making this box, they were able to accept it. So in care facilities, if you just put the VR goggles, there aren't really many people using it. But in this facility, they have a QR code next to a image. And this QR code, using your smartphone, you can scan it to see the videos like Venice or 360 degrees video contents easily. And based on this movement or the path that's in the caring facilities, the analog generations who didn't really want to try on the VRs, it brings them also an opportunity to start a conversation. So in a short period of time, I was able to share with you my cases or the activities that I have done. I believe that COVID-19, amid the changes of the society, stands digitalization or internet is an important tool. In Japan, we have the aging society, which is rapidly speeding up. And for the seniors, I believe these usage of recent devices and for them to enjoy them, I wanted to introduce you the methodology regarding that. It was a very short period of the time, but thank you for having me on this online platform to give my presentation. Thank you.
Thank you very much. It was an online lecture by the Toshima Kenta. So the tourism vulnerabilities or the socially marginalized, they were the target, and they initiated this new service. Seniors were making these VR contents, and the seniors were enjoying it. I think it's kind of like a VR therapy, not just like the encouraging participation or enjoying those. Due to the COVID-19, actually people are having more interest in the VR. It was actually dealt by some of the replies on the YouTube chat. the VR industry will be expedited and developed further. From the universal design, which was dealt yesterday, the digital marginalized people were talked about a lot. The digital technologies are combined with a design concept, and we can think about this aspect, how we can improve the society using this concept. And let's move to the next one. This is the last one, the convergence to the humanities, society, social studies professor, and how we can connect with customers by using the new normal design concept. Let's invite the professor ㅍSocial from Yonsei University.
네, 안녕하세요. 네.
Good afternoon. I am the last speaker of the last session. My name is ㅍSocial. I would like to talk about let's design a new connection by emphasizing with your customers using design thinking in the new normal era. So, what kind of impact the COVID-19 had on our lives, and also how we can tackle these problems using the design. Those will be the topics for my presentation today. I think the buzzword for the whole year is COVID-19. Not only this year, but until the next year, I think the COVID-19 will be talked about a lot of people. And what do you think the COVID-19 is? What's the definition of it in your daily lives? A lot of people were suffering from the economic difficulties or the physical difficulties. So when we talk about the COVID-19, for most people, it will be kind of negative connotation in economic and social cost. How our lives were changed. Can you see this picture? It was taken in the early of this year, and there were kind of like the COVID-19 prevention mask was kind of like a big issue, and only like 2 masks could be bought, which was kind of like public, the mask purchase, the project, and some had to pay more to buy the masks because you could not buy masks anywhere else. And some were really panicked, and offline society was really attacked a lot, and many were confused. One thing interesting from nowadays is that at first, well, you were really keen on like buying masks, but nowadays, because you are wearing masks all the time, you might feel like weird if you see someone who is not wearing the mask, or if you don't have to wear the mask. You see the left one in the right picture, you see like automatic temperature the sensor. So if you're not healthy enough, then you cannot move, and actually that's the fact. Well, this was already another like unprecedented case compared to the pre-COVID the era. This kind of like the temperature measures or the washing hands are like uncomfortable, but I think it's so natural these days if you don't do it. Well, these photos were taken the restaurants I go sometimes. Well, when you want to go to a restaurant to eat some meals, you have to make a record that you visited this place using the QR code or making a log. And well, before you could freely talk and enjoy delicious meal, but it's kind of like prevented these days. One thing interesting for me here is that the QR code check-in. Of course, well, it's kind of like difficult for us to use the restaurants like we did before in a free way, but well, when it comes to the QR code, actually it was developed really long ago, but we were not using this like in this way. It's a new one, like, so you have to leave this log so that you can eat something with
your acquaintances. This is my office from my place. Well, previously I had to go to the lecture room and my office. I would prepare my a lecture, but because of the COVID-19, I had to stay at home, and then well, I thought that I could give a lecture from my place. I just thought like, well, maybe one laptop is the mandatory one, but well, with only my laptop, it was difficult to give lectures like I did in the campus. So I had to buy 2 large-scale monitors and also the high-quality microphone. I just felt somewhat like I'm kind of like YouTuber or the BJ who are really famous. Well, that was what I felt in the early days of the COVID-19, but now it's kind of like a natural, and I could see a lot of development is happening in the area of this kind of like connecting to the internet and talking to other people. Now, the working from home is just our lives. This was actually an unprecedented and new experience, but nowadays a lot of people are experiencing these new types of working method. Around the world, about 1 million people lost their lives. As of yesterday, 22 million people lost their lives. And a lot of them felt really fatigued and physically and mentally, and you could see a lot of people were bursting into fears because they were so stressed out by the COVID-19. It was like uncertain, and it's even like very difficult to predict how the COVID-19 the spread would change its trend. When you look into the data released from the IMF, the economic forecast worldwide is minus 4.4%. Well, I think the economic growth will be just I can say like not, it cannot develop that much, and to predict economic change, to forecast the the change is also important and difficult, and the overcoming these changes is a task. To overcome these, we prepared a lot of the measures, the remote learning, drive-through, like contact-free. It's saying like untact, but actually untact is not an English word, but it means like contact-free. It's called the home too. That means like you are getting training from home, and hand sanitizer, social distancing, washing your hands, screening, clinics, mask, quarantine, and self-quarantine. All those solutions, can they change our lives that much? I think this kind of stopgap measure, it's not a permanent solution. It's not a measure, it's just an ad hoc solution. Do you think these measures will continue forever, or do you want to go back to the old days that you could have fun by meeting with your acquaintances and having fun and talking each other? From that point of view, I think all these measures are stopgap measures. Then what do you think the COVID-19 means to us? Well, like I said, COVID-19 was kind of like negative connotation, but now maybe we can take a new attitude. Maybe we can interpret that phenomenon as a kind of a new normal. So it's a new request for going after the new method. COVID-19 is requesting us to change our attitude and adapt to the new trend. It's like a design of like new connection, because there were some people who were going through difficulties in the past, and well, we can connect the difficulties that people experienced before the COVID-19. This one was taken at a restaurant. Like you can see, you see some of the partitions, and you can see the Wi-Fi codes. Maybe you can just think that, well, this was taken, and you might thought that this was taken in the early days of this year, but actually it was taken last year because there were some people who were eating alone. So that's why they prepared this kind of booth type of restaurant who had to go to the restaurant by himself. Before COVID-19, there were some needs in the changes in the new era. And Amazon released the service, the Amazon Go. I visited this Amazon Go and I recorded some of these video clips, and we can see that together.
QR코드를 활용해서 취입을 하는 모습이 좀 인상적이고요. Thank you. 자, 이게 아마존 고에서
So this is a shopping experience that I could go through the Amazon Go. We use QR code to go into the Amazon Go, and this is actually an untagged. I didn't see any employees, and there wasn't any shopping lines to checkout lines. This was possible because this is part of the fourth industrialization and also IoT and big analysis of big data. And this was possible, and I believe that this is similar to the situations that we will depict after COVID-19. This is not only limited to the United States. You can actually find it in Korea as well.
네. 세부적인
So if the details are kind of different from Amazon Go, but if you see the operation of the store is based on the untagged and increase of this unmanned stores. I think this is something that we will see in the near future. Now moving on to this unmanned stores, the reason why I brought this up is due to the development of technology in fourth industrialization. In this fourth industrialization, we have 4 behavioral changes in people, which first is the education, work type, work style, lifestyle, and lastly is the way that you enjoy leisure and recreation. Going forward in the academia is a belief that will be mainly around the online classes that they work to, and secondly on the work style is that they are not gathering in a fixed office, but rather they will be able to freely join in an online virtual space. And actually that because we are trying to remove the most of the concentrated spaces, we will see the reuse of those spaces where people can enjoy and rest at those spaces. As you can see, these situations or the circumstances that we see are in line with the lifestyles that we see after COVID-19, and there are similarities in that. Another similarity is that in order to make this possible, a critical factor is connectivity. So this is a graph regarding trends. I want to talk to you about trends, which I think that can be divided into two different types. Trend is very short period of time that runs with a high impact. Another kind of trend is lasts long and also has an influence, which we refer to as a wave, which has an influence in a long-term basis. So we talk about the fourth industrialization or the life patterns of people after COVID. I believe there were the signals, the triggers of trends before. However, with COVID-19, that it has worked as a catalyst as the trends, and I'm sure that you can see that for yourselves. So these new ways of connectivity, they're resistance because at the moment, the resolutions that are provided does not reflect the communication and the connectivity in the past. So in other words, the customers or the need expectations, it is not fulfilled. So in that wise, I'm gonna show you another relevant video.
되게 촉박하지 않고 오랫동안 생각해서 선택할 수 있고
이 사각지대 없이 다 인식을 하고 있고요. 고객이 큰 소리로 비명을 지른다든지 이상 움직임이 감지가 되면 보안위원이 출동을 하고 있습니다.
저 질문 하시려고 하는데 기계에 대해서 궁금해서 물어볼 사람을 찾아도 직원도 아예 없는 상황이고 알려주지 않으니까 되게 나가시더라고요.
학생들 구하기 굉장히 어렵거든요. 그리고 구한다고 해도 애들이 오래 하지도 않고 PC방 요금은 거의 올라가지 않는데 인건비는 꾸준하게 올라가고 있으니까
많다 보면 개선하는 것도 좀 힘들고 그랬는데 기계로 하다 보니까 편리하고 좀 빨리 할 수 있다.
상황에 딱 들어왔을 때 이제 자리가 잘 안 치워져 있다거나 그래가지고 약간 좀 거부감이 좀 있는 것 같아요.
직원분들이 10시, 12시쯤에는 가시니까 미성년자들이 오기 쉽겠구나라는 그런 생각이 들었습니다.
치는 기계같이 생겨서 컴퓨터 기계라고는 생각하고 있습니다.
신기하다고 생각했는데 로봇이 뭘 만들어서 나한테 이렇게 준다 이런 거를 접해본 적이 없어서
어플이나 무인 계산에 성공합니다.
젊은 분들이 이용하기에는 좋은 것 같은데 좀 나이 드신 분들이 이용하기에는 처음엔 어려운 것 같아요.
메뉴를 고를 때 좀 생각을 해야 되는데 사람 앞에 있다 보니까 부담되는 것도 있고 그런데 기계 앞에서 하면 괜찮은 것 같아요.
메뉴에 대해서 그냥 물어보거나 이렇게 점원에게 도움이 필요한 부분에 있어서 자세한 걸 물어보지 못하고
인증 절차 없이 좀 당황스럽습니다. 미성년자분들도 쉽게 너무 구입할 수 있을 것 같아서
세상이 이렇게 발전하다가는 앞으로는 좀 사람이 필요 없지 않을까 싶은 이런 생각도 들고 과연 그렇게 됐을 때 사람은 뭐 할 것인가.
전체적으로 다 그런 게 된다면 나이 든 사람들은 그거를 잘 못 쓸 것 같더라고. 못 따라가죠. 어떻게 따라가요. 지금도 힘들은데.
네.
So there are various resistances, but you can see the remarks of the seniors in the last two of the videos. So if we take a comprehensive analysis of this, that these new ways of lifestyle and new kinds of methods or the changes that we see have a greater impact on those digital marginalized. Therefore, we need to prepare for that. As you can see on the screen here is a kiosk to make an order and see the customers who are having difficulties to do so. So actually humans are social animals and they want to be connected. So if you disconnect, that they suffer. So in this respect, how can we find connectivity in this resistance? I believe a solution can be design thinking. So what is design thinking? It was mentioned also in the first lecture of today's sessions that design has various kinds of definitions and processes, which we can all bring it all together to bring a definition or concept. What the design thinking means that it emphasizes with the customers to do the analysis, to provide solutions that will fulfill the customers. So in doing so, what is important in design thinking? This is not focused on the creation. It's rather around the emphasis of people. I think this is the key factor that I want you to take home with. So what is the role of design thinking? As you can see here on the screen, that there are two novels. One is Vegetarian, written by Han Gang, and Parasite, movie Parasite by director Jun Ho Bong. Actually, it was awarded movies and fictions. And actually, the reason why they were able to do this because they had these two translators behind them. I think this is a role that the design thinking delivers, that they shares and delivers this empathy. So by doing so, they were able to deliver the sympathy to the people who speak a different language, but was able to translate to that language. So this is a picture that I actually randomly took while I was walking on the streets. What can you find in this photo? Actually, I think you will be able to see that this is an wheelchair that a citizen is using, and you can see that the person is riding on that. Actually, on this wheelchair, this person who is moving together with the wheelchair, because with the efforts of their own and probably based on with their own cost, he actually installed this foothold. So design thinking means that in the field of the customers, learning the language to emphasize and to understand the behavior, cause, and solutions, to find a methodology and solution to that. By doing so, we'll be able to find these kind of cases where that creates the value. Now I'm going to introduce to you another case I think you may be aware of. There is a Pyeongtaek new city in Namyangju. One of the policies that it conducts, there's a very unique characteristics to it. It is really well communicated and transported, but we saw a lot of accidents with the seniors. So, and a lot of jaywalks done by the elderly. So we wanted to find what that person wanted to identify the cause of it, and to started to think in the shoes of the elderly. So that person tried to emphasize with the elderly. So what the identification was is that these people wanted to had this burden, this physical burden. So it was very difficult for them to wait for the green light to go up to the crosswalk and to wait for them. So they wanted to reduce their mobility and the path that they need to move. So that is why, unfortunately, they had to jaywalk. And due to that, what the social cost was derived from that. So this police officer in Namyangju talked with the city government to have a longevity chair, which is around the crosswalks. So before the green signal changes, the senior citizens can sit here on this chair and wait for that sign change. So it actually started from Pyeongtaek, but I think if you look around, you'll be able to see these chairs in the crosswalks. And in the one in between is in the middle, you see that it is multi-directional, and the far right, what you can see is chairs more modernized design installed in Seoul. I would like to introduce you to another design. I'm sure that you have experience of blood donation, and when you donate your blood, I think this is a critical factor as a composition of the society, but it's actually difficult to earn agreement. Had a consulting requested by Red Cross to boost the blood donation participation. The conclusion was that to give them a real reward. So what does the blood donators actually want? What value do they strive or look for? They wanted to be recognized for the value that they provide to the society. So they have a why I give kind of statement that people who donate their blood write out before that they donate, and they install this, or rather introduce this system. So next time when they see this on the board, when for a second blood donation, they'll be happy to see their statement on it. Lastly is the cigarette butt collecting equipment. You can see that on the left is well designed, and on the right shows that what social value it has by throwing out the cigarette butts in that bin. I believe that you will be able to identify which one was more effective. So before we go on with the design, we need to re-identify the design job and to be capable of design. We only do not stall on the design itself, but we also need to understand the needs of the customers. And based on this definition, we need to seek for new opportunities and look for empathy and to find a consensus and to earn the insight of the customers to deliver new ideas and create new ideas and to sustain this creative culture in our society. Lastly, I'm going to speak about new normal. What new connections do we need, the design principles regarding this? First is that you need to repeat the empathy and the creation. You need to think under the design thinking. You need to repeat this to provide more value to the citizens. Second is that you need to identify the actual problem, not the diagnosis or the symptoms. You need to identify the needs, because you only at times you just stop at the symptoms, but you really need to go deep and understand their actual needs. Thirdly, the social problems that we mentioned, that they're always intertwined with these stakeholders, various stakeholders and their conflicts, so you need to focus on the synergy maximization. Also, you should seek for participation of the citizens. And lastly, you should not try to be so rapidly coping with the changes. You need to actually find a sustainable measure to resolve this issue. So this is what I have prepared for today. Thank you very much. Thank you, Professor of Seung-Seo, on your last presentation. So this COVID-19, what has it changed? It is not just the approach, but also the speed. We say the lifestyle changes led by the fourth industrialization, and we believe that COVID-19 is playing the catalyst in bringing these changes. And to prepare for this, we need new connections, and for these new connections, we need a design thinking founded on, or rather based on, the empathy. Thank you for joining us until the last session regarding the design with the local speakers here with us today. I would like to thank them again. This is the second day of 2020 Seoul Design International Forum. In session 1, we spoke about social problem solving design, policy and vision for post-COVID-19. In session 2, we talked about crisis response design. And lastly, we discussed design for era of no face-to-face. Lastly, we have the panel discussion left. But before we start, we have about 10-minute break. We have the video clip by the Seoul Metropolitan's policy design, and we'll take a break, 10-minute break, and resume at 5:05. Thank you.
구체적인 활동과 방법을 5단계의 디자인 싱킹 프로세스와 40개의 지표를 통해 알려줍니다. 준비 기획 단계에서는 사업을 진행하기 전 주제를 기획하고 운영에 대한 프로세스를 구축합니다. 공동 디자인 개발 단계에서는 시민 중심의 진짜 문제점을 발견하고 이를 해결할 수 있는 솔루션을 구현합니다. 유지 관리 단계에서는 솔루션을 효율적으로 관리하고 홍보하기 위한 계획을 세웁니다. 효과성 평가 단계에서는 시민의 여정에 따라 평가를 계획하고 솔루션의 완성도와 영향력 등을 평가합니다. 확산 단계에서는 협업 주체들이 함께 노력하여 문제에 집중한 확산 계획을 구축합니다. 사회 문제 해결 디자인 프로세스를 활용하면 어떠한 혜택을 얻을 수 있을까요? 시민은 지역의 운영 주체가 되어 사회 문제 해결에 주도적인 역할을 할 수 있습니다. 서울시는 시민 중심의 프로세스를 바탕으로 시민 협치를 이끌어낼 수 있으며 효과성 평가를 통해 사업의 타당성을 확보할 수 있습니다. 자치구 및 유관기관은 사회 문제 해결 디자인 사업 확산을 위한 길라잡이로 활용할 수 있으며 수행사는 시민 중심 디자인 개발 역량을 향상시킬 수 있는 교육 자료로 활용할 수 있습니다. 서울시 사회 문제 해결 디자인 프로세스에 대한 자세한 내용은 아래 링크를 참고하세요.
되게 자주 오는 곳이지만 낯선?
되게 쉴 공간도 되게 없어가지고 교실에서 대충 의자 막 쌓아놓고 거기서 막 누워있고 그러고 했었는데
학교 기숙사였으면 혼자만의 시간이 필요한 법인데 기숙사는 공동생활이다 보니까 그런 부분에서
왜냐면 학교가 따뜻한 느낌은 전혀 없었거든요. 왜냐면 솔직히 학교 얘기하면은 따뜻한 분위기보다 차가운 분위기잖아요. 네. 되게 좀 갇혀있는 느낌이고
촬영 장소 아니면은 공부하는 곳 스트레스를 풀고 싶다 그럴 때는 학교가 아니고 다른 데서 항상 나가서
우리 서울 영산고등학교는 그 예술성이 높은 학생들이 많이 지원을 하는 학교예요. 편집을 맡거나 기획을 맡거나 또 기획 아니어도 제3, 제4의 인물들도 일단은 눈치를 또 보게 되는 여러 가지 스트레스가 있어요. 그리고 편집한 친구는 밤샘 작업하는 건 뭐 거의 뭐 매반 일어나는 일이기 때문에 그런 데서 오는 육체적인 피로가 상당히 사실 많고
이제 곧 고3이니까 학업에 대한 스트레스가 가장 크고
그리고 막 과제 같은 것도 좀 많을 때는 막 밤새서 작업해야 할 때도 있어가지고 막 그래서 되게 스트레스가 많고 피로하기도 하고 그랬었어요.
학교가 좀 작다 보니까 친구들도 이렇게 오목조목 모여있고 해서 소문이 한번 이렇게 딱 나면은 되게 크게 파장으로 생겨서
가끔마다 행사 있을 때 뭐 참여를 하게 된다면 거기에 대한 스트레스도 받고 아무리 즐거운 일이라도 뭐 부담감이 생기고 긴장이 되고 하니까.
스트레스를 풀고 싶다 그럴 때는 학교가 아니고 다른 데서 항상 나가서 했었죠.
기숙사에서 생활하면서 학교를 마친 뒤에는 약간 갈 데가 없고 즐길 데가 없었는데
이제 저희가 편안함을 느낄 수 있는 장소나 좀 여유로움을 가질 수 있다고 생각이 드는 장소가 거의 없거든요. 흰색 분위기에다가 좀 되게 편안한 느낌이어서 되게 신기했었어요.
이런 스트레스 프리존이라는 안전한 학교에 있는 공간이 있어서 친구들과 조금 더 진솔한 이야기들을 할 수 있었던 것 같아요.
스트레스를 측정하면서 친구들과 그것에 대해 이야기를 나누며 여러 가지 정보도 알게 되었습니다.
이 대안이 없다면 참 힘들었을 것 같은 생각이 지금도 들어요. 또 이 쾌적하고 깔끔한 이 공간 때문에 애들이 너무너무 좋아하는 거죠. 그래서 바라보는 우리도 너무 흐뭇하고.
스트레스 프리존을 10점 만점에 몇 점이라고 생각하냐면요. 저는 10점이라고 생각합니다.
저는 9점? 왜냐면 한 1점은 왜 이제 생겼냐라는 느낌?
스트레스 프리존이 생기기 전에 다니던 학교는 8점, 이렇게 스트레스 풀 공간이 생기고 난 뒤에 학교는 10점 만점에 10점 줄 것 같아요.
네,
2020 Seoul Design International Forum Social Problem Solving Design is the theme today. This is the final session, and from now on we will have a panel discussion through live streaming. In this crisis that we are faced by us, how can cities can strengthen social resilience? We prepared the venue to listen to the voices of panels. First of all, the moderator Gu Yuri from Hongik University will lead the session, and Director Lee Hae-young from SMG, and Yoon Ju-hyun, Shim Jun-woo, Choi Ju-won, and Professor Seo Seung-kyo are panelists. For better solutions, please, the online participants can leave your message on the YouTube chat. And by doing so, we can have an enriched international forum. Then I would like to hand my mic over to Professor Gu. Good afternoon. I am the moderator, Gu Yuri from Hongik University at this session. And it is my great pleasure to lead this session at the 2020 Seoul Design International Forum. And many presenters gave valuable insights. Maybe you might wonder what the social problem solving design. It might be kind of new to some people. I think the definition of the design to solve the social problem solving is that a concept with 3 keywords, and the civic difficulties and social difficulties will be solved from this kind of design concept. And I thought that all those contents prepared today were covering this. And the social value in the past was related to economic matters, and then it was separated from the economic matters, so they were 2 separate concepts, and then they could not be dealt with together. But nowadays, the social value and economic value are co-prosperating. And in the era of COVID-19, I think the companies seeking for the social value also can have a chance to develop even further. So through these sessions, I think the design's potential and the visual competency and creative spaces and cooperation abilities are the themes. And before starting the session, we asked common question to our foreign speakers. So we will listen to the foreign speakers, the answers, before starting the Korean speakers, the session. And the question was that in the post-COVID-19, is comprehensive and multipolar social issues should be addressed, and what kind of core competency the design should have to that end, what kind of attitude the designers should have. So connecting to the concepts, our foreign speakers gave those answers. Let's listen to those first.
I would say that the core competencies that people really should have in dealing with really complicated and multifaceted sort of problems during COVID and post-COVID are really fundamentally to have empathy, to be able to deeply understand the people involved in the situations that you're addressing, and also to be curious, to really be looking for insight where it may not be readily apparent right when you see it first off. And the other thing that I would think about is that you need to be looking at the trends, so looking at what alternate futures might look like, to think about, okay, if this were to happen, then this is the design that's appropriate for that. If this happens, then this is the design that's appropriate for that. And the overall attitude is one of making sure that you stay vigilant and constantly look for changes in the environment as well. We're in a situation where things are changing very rapidly, and we need to be conscious of those as we go. So I think those are the central core competencies and attitudes.
How do you acquire all of the knowledge coming from other professional backgrounds? So in the case of post-COVID, it's really about how do you look to public health? How do you acquire the knowledge from the public health research community and translate that so that it's directly relevant to your practice as designers so that you can apply it into the design practice to ensure that the spaces that you're creating, the buildings you're creating, the public spaces you're creating are optimized so that you can address future outbreaks, so that you can really look at how do you create spaces that are optimized for people. Because we know, as the Center for Active Design, I mean, this is the work that we do. We translate between public health research and designers. We know that environments can be optimized for people, and you can address social issues with public space design. You can address trust. You can address issues of agency. You can address mental health with design. You can address infectious disease transmission with design. So it's really about educating yourself as a designer and being open to these ideas and accepting that as designers, we were not originally taught that we had a role to play in health, but we absolutely do. And I think that it is incumbent upon ourselves to acquire this knowledge and then feel confident that we have a role to play post-COVID in really being part of the solution.
Well, first off, on the basis of my experience on this project, I think that the competencies required for designers are twofold. The first is agility, really an ability to be able to change direction as and when needed to. So in the project I just showed you, for example, the social distance metric was reduced by order of the UK government from 2 meters to just 1 meter a few days before we opened the lab. And this changed quite a lot of our approach, but because we designed the methodology as truly agile through the use of computer-generated algorithm outcomes, it was relatively straightforward for us to change all the signage because the computer would work it out instantly. Had we designed it in a more traditional way, all of our design work would have been quite useless and thrown away. So I think designing in agility into your design is very important. I think the second core competency is robustness. I mentioned earlier on that really design has not been a high priority in the approach to social distancing or in communication about COVID-19 to citizens. And I think that this really was a result of the extreme pace of the virus catching us all off guard, and governments and businesses thought, well, let's make do with what we have. But I think now there's been some time to reflect on this, and we should all, as designers, be reminding our clients and those who decide policy, so local and national governments, that COVID-19 is not the sole remit of the scientists and medics. Rather, much of the effort for the reduction in spread has been through the carefully designed communication, either verbal or visible, to citizens. And that's achieved not just through scientific policy, but through communication. So I think designers should be robust and remind clients of the important role they should play in the recovery effort. I suppose in terms of the attitude a designer must take on in order to fulfill these competencies, I believe that agility is really only truthfully achieved by open-mindedness. So to achieve this in our project, we asked for evaluation and feedback from users of our outputs at every opportunity. And I suppose the reason for this is that the design development period for COVID-19 products has understandably been cut incredibly short in some cases. So in total, the design development of this new signage project was just 3 weeks. In previous jobs, I've seen the same output take at least a year to go through various stages of evaluation and approval. So design now, I think, is to be prepared to incorporate and plan for much more user evaluation and feedback very early on in the design cycle. So I think, thinking back to your question, the attitude that designers need to take on for the second competency, which I decided was robustness, is really to have confidence in the value of your work. You know, history provides us with some fantastic examples of designing out some of the most difficult problems that we've faced. In the UK, where would we be if we didn't have the famous London tube map to guide us around the underground subways of London? Well, we'd be lost. So we're faced with this new problem, a problem that all citizens need to understand very simply and very quickly. And I think design sits very clearly in this space. So be robust and be confident about your work. It may be more valuable than you believe.
네, 세 분 연사분들께서
Thank you very much for your feedbacks from the three presenters. I think the keywords of them are actually one keyword. So understanding of the human beings and open attitude. So they have to have a creative self-confidence, and designers should be able to trigger certain competences in our society, and we should be agile, and design-related competencies should be strengthened and developed further. So that was the point. And I think at this session, I think we can talk about it one step further. First of all, we have an order of presentation. There were participatory questions, and the others were the pre-asked questions. First of all, I would like to give my first question to Director Lee Hae-young from SMG. The social problem-solving design has been initiated from the 2010. So it will mark 10 years after next year. So in the face of COVID-19 era, I would like to know what would be your future focus next year. Seoul Metropolitan Government was thinking about the stress-free design or the human body design projects, and various projects were being conducted. And during the process, actually, the design policy department could not make a decision by ourselves, but actually we had to work with other departments. And during the cooperation process, we were facing some difficulties because it was like one-time event or the project. So to prevent that, because we've been conducted various types of social problem-solving design projects, now we are trying to expand these projects to the broader range. And to do that, there are some areas that the public sectors can do, but we can connect to the private resources or the sectors or other human resources in the governmental area can be connected. And then maybe the Seoul Metropolitan Government's cases can spread across the nation. And we saw at the video clips made by the Seoul Metropolitan Government, and the government was actually implementing numerous measures to address these kind of social problems. But I think there were some difficulties to address or to promote these issues from the point of design. And then, with regard to the design, handling the organization, what was your difficulty? Well, when we were working with the other department in cooperation, the understanding about the design was totally different. So their awareness was different, and I actually thought about the color or the shapes or this kind of simple aspects were only considered as that of the design, but rather it's more complex and it's an overarching concept, even through which we can change the culture of the organization. That's also one of the solutions to address the social problems or the issues. So the most important
thing is that you have to feel the necessity to address this. We work with the welfare department or the tourism department or the road management department. When we are collaborating with them, it's not like extraordinary work, but rather to increase the performance of the achievements. We have to cooperate and change the concept to have a better impact. Let's move to the second panelist, the Ms. Yoon Joo-hyun, and you shared various design trends and cases, and also you talked about the contact-free, the new normal era's design trend, and some people wanted to hear more from you. So would you share that with us?
So when we mention untagged, first we can mention about digital, which is also linked to data and software platform as well as system. There is correlation among these. If I was to speak around data-oriented, it is regarding collecting personal data, which we see it as an issue in design as well, and also how we can visualize this data. For instance, we use infographic and database is also raised as issues in data as well, in design as well. How can we have a mix of a hybrid of on and offline and online, which we believe is a mix of hardware and software? In addition to that, when we speak about platform, how can we mix the software and hardware? How can we compose those and to bring it out and put it on the floor? And if this is referred to a system, that we have the data that can create the ecosystem to make an industry. This is what I think of. But when you hear about digitalization, but we think that it kind of feels cold and it doesn't have any emotions into it, then in this sense, how can we maximize the empathy? How can we bring those emotions? How can we bring friendliness to in this picture as well? We include feedback. We also heard that during the presentation about feedback, and we actually have received feedbacks from the people because we were having an online, but we didn't have an immediate feedback. But we would also like to ask for immediate feedback so we'll be able to understand. Thank you for your answer. I think you have emphasized on the linkage and the connection, but it's not only between the technology itself, but also we need to create a harmonious connectivity with the people and the system and the digitalization. Well, with this untagged, we see the rapid development of this digitalization, and I think that those of you who are participating in this forum are kind of fear and also welcoming this digital era. And I believe that based on your answer, I think it has kind of given me a different perspective to see how this digital era would be. It's not a one-sided way where it only focuses on digital, but we can have a wider perspective of this digitalization. Now I would like to ask Junho Shim of OSAFE CEO. You had a very exciting and fun theme, even though it was actually kind of heavy or important theme. However, you kind of turned it and switched it into a fun, exciting subject. And I think by doing so, you're able to illustrate the value that it holds. So to CEO Shim Junho, the question that was raised is that I think most of people are curious about and want to know. Design firms are actually faced with difficulties due to COVID-19, and I guess these questions came from those who actually operate or run the design firms. So in this after post-COVID-19, in this new era, what can we do? What approaches can we take on the design firms to strive in that era? So to give you an answer, so I understand that some companies, or I think it's actually from a CEO who is having difficulties due to COVID-19. Well, myself also, I am operating a company that is faced with difficulties due to COVID, and that is why I really empathize with your question as well. But actually, if you think about it, a small forum like mine with a design company, even previous to COVID-19, we were faced with difficulties. I don't think we really had a really good times or the good tides of it. So, but if you think about it, because of COVID-19, the existing opportunities have changed into a new opportunities. So when I was asked with this question, I thought about what answer would be helpful to you. What should I share with you? I think there are two notions to that in running an actual running a company. If you see the actual work of the design and running an organization or a company, I think this is fundamentally different, because the reason why I want to speak this to you is because we need to practice our ability to see what's beyond our visibility. So for example, if a design project comes in, that we need to think about why that client has asked for this project, why this project start, where did it start from, why does it exist, where does the budget come from. We need to think about all these background processes that are in the back of the project that we're actually working on. So if we look at this step by step, and in that process, I believe that we'll be able to find a great opportunity. And actually, I have prepared something, but I don't see it now. Excuse me. And I think it's somewhat personal, but to share you with this story is that in running on a company in this rapidly changing society, you have to think about whether you can really focus on your business. Can I focus? Do I have the time? Do I have the wellness, the health to focus on this project? How is my family? There are all these various factors that may influence the operation of the project. So you have to think about what are the resources that you could invest in leading this business. So before you step up, you need to think about and review yourself. So actually, I'm also faced with difficulties, and it's really to give you an answer on this because I'm in the same situation as you are. But I hope that we can think about it, and hopefully our design industry could robust.
Thank you very much. I think every single designer would empathize with your thoughts. And you mentioned about the failure scenario in your presentation, and the no interest among people were actually the problem, and when most of people were avoiding kind of warning message naturally, and you pointed it out and you worked on it to make other contents, and I think it was kind of a new idea. I think when designers are bringing up new ideas and contents, I think those fun aspects are very important. Where do you get that from? This is also my personal experience. Well, I read a lot of cartoons, and I watch a lot of animation. When I was in my 20s, well, people around me didn't really think that I was paying attention to those areas. Some mentioned, well, isn't it not that inefficient, and some were looking at me with some thoughts in their mind, even though they didn't express. But still, I really want to tell people that, well, you don't really have to care others, but well, if you have any interest area, just dig into it. Well, when you are really working in your company or business, then you cannot have interest and spend time in the interest area. So when you're in your teen 20s, or if you're teenager, then still, well, if it's allowable, then you can spend your time as a leisure, and then maybe eventually it will help you in the future. I think many young designers would emphasize with your idea. And also the Joanna Frank, in her
answer. She majored in design, but she had to study about the health, and then she had to learn about it, and then she had to deep dive into a new area, and she had to adapt to this kind of new part and had to create something useful tool. So we have to understand various parts, and let's move to the next panelist, the Cheju-won, the developer of the COVID whereby, and you were the youngest panelist, and you were the youngest the presenter and the session. So you tried something, and then now through that experience, now you became a person who could give a presentation in front of many people. And I just want to know how you feel about it, and then you might have several questions surrounding the developing these ideas. And you have to work with others even though you are working in the technology area. So when you were working on this COVID whereby, wasn't there any difficulty in collaboration with other team members or communication aspect? So what I think of a designer's role in collaboration, I think there are two required abilities: the ability to communicate well, and also no resistance to or open-mindedness to a new tool, usage of a new tool. Actually, those who are in the similar industry, likewise, I am a developer who's in a similar industry, that I think that there's no relevance in whether it is intact or untact, because we can use Trello or these kind of tools to do the development. And I believe for the designers that you can actively use those tools. If you have efforts to understand and use those design tools, it would facilitate your designing methods as well. And also, if you may have a insufficient time to actually explain about your face-to-face from PR, then you may have to spend more time to communicate in a more convenient or more fruitful manner. So I think this is actually a valuable experience that you have taken as a university student. And based on this experience, the values that you have achieved, is there anything that is directly related to your dream or in the future? Actually, I don't have a clear dream or future, but in order to have a similar success or to have a fruitful success, I want to focus on that, whether it is a product, whether it is design or development or a system. I want to make a successful product in the given environment. I think when you say good or success, that it includes a lot of meanings. Something good that is for the society and for the economy and for the people. And I think COVID-19, actually, your app alert system started from that notion and was able to implement those factors as well. And this is the last question raised to Seung-Kyo Seo, of the professor of the Yonsei University. We have this design forum and we invited designers, but also we have participants who are looking at the multifaceted perspectives of design. I am aware that you are a management major, but you emphasize on the design thinking. What do you mean as a designer to find the value in design, especially in this changing world? What is that? What really is that? So as you have introduced me, I majored in management, and before I actually came out to the field, I believe that design, IT, and management, they're all separate divisions or separate sectors. In order to create a creative product, you can see a conflict between the three sectors. And there's some learnings that I have gained throughout the years of these conflicts. They may have different terminologies, but they actually strive to the same achievement. They want to satisfy their users, their consumers. So they're talking about something else. They may be talking about different stories, but they're actually aiming for the same objective. So I believe that if you understand the similarities and if you understand the vocabularies or jargons that are used in discussions, that I think we'll be on the same page. We'll be able to achieve that. Like ㍍Shim has said that in order for you to design, that to operate a design, you have to use the design jargons. But management is different. But whether you are in a design industry or you're a consumer or you're operating your own, I believe that you have to put efforts to understand each other's vocabularies and the stories behind that. And I believe design thinking, that it is attracted attention because using the conventional approach that those of you in the large companies take an approach to have various strategies and taking theoretical approaches. So based on that, they'll be selling products and services, and based on that, they'll be able to accumulate assets. I think those theses were from the past, and it was true in the past. However, now the competition is very fierce among companies, and the technology standard is actually far beyond our speed. So therefore, what is important as a customer, what does the customer really want, is really how this approach could be taken regarding design. We need to put this emotional touch into it. What does the consumers really want? If we think about these elements or the factors, I believe they will be able to enhance the design sector. And in the same line, I believe that design, technology, and management are in the same page. So actually, when I teach my students at school, I think about the principles of a designer. We say that these are like invisible attributes that you have, the capacities that you have within that's not visible. What can you do for the society? What can you do for the organization? I think these values have been underevaluated. And as we can see from the answers of the foreign speakers, that we need to have confidence. We need to have confidence in the creativity that we have, and based on those capabilities that we have, will play a very critical role in this sense. And I believe it is in the same line that you spoke or you gave your answer about. Thank you for your answer. And now I think these were the individual questions that were raised to each individuals. And now we have about 15 minutes of time. So actually, I'm going to raise this question, this common question that was raised to the foreign speakers, and we can kind of have a discussion regarding this question. So this is a design forum, and we are discussing about what role design can play in resolving these social issues. And the theme of this forum is design for social resilience. And in this sense, what do you think of the core factors are in social resilience? Can you speak of the keywords? And I think the keywords may be duplicated or maybe different, but I think based on that would be the starting point of our discussion. Who should I ask first? Can I ask director, or should I ask? All right. Well, before we starting mention, I think I have to talk about the designer, and you're running a business, and I really agreed and emphasized with you because actually I run my own business for 5 years actually, so I really kind of like have a feeling that I could understand how much difficulty he had. We talked about the crisis in terms of social problems, and it was a little bit different today. And maybe we could think that we are facing a new opportunity after running the business. I could feel that there were some difficulties, ups and downs, and I'm not so sure it was the first year or next year, but well, it was like February and July. There were some works, but after that, there was no the projects or task. And what did we do? Intranet, ISO standard certification, conducted research, and researched and added my company as a venture company, and we arranged the data and we updated our portfolio to strengthen the competency of the members of the company. So maybe you can try those efforts to strengthen your company's competence. And there were several the disasters and devastating the crisis. These are actually the gloomy aspects, but well, the head of this company had an ability to cover that area with like a fun aspect. So I think he has an ability to cope with this kind of crisis. It's called a new resilience. It's very important. So to do that, I think, well, people have to have like adaptability to a new challenge or a new crisis, especially when you are a designer. Well, we talked about the creativity and open mind. And then to that end, you have to be enthusiastic yourself to do all of the things. And you have to have your own approach towards this kind of crisis. So these will be the core competencies to live in this difficult world. I think that the adaptability to the change is a key word. When you face a difficulty, rather than avoiding it or taking an extra route, but maybe you can take it as an opportunity actively. Do you like her advice? Well, ISO registration and venture registration and portfolio preparation, that will be my next step. And can I answer your question also? Well, I think the keywords may be like kind of like glancing at those, you know. Well, if I know to this extent that many of designers are focusing on making the outcomes, but there are the before and after of the outcome, the production. Are there like enough level of planning, and what kind of process are there? Actually, it's not about the process, but it's about budget and resources. So for implementing effectively these budgets, then we have to segmentize these areas to run this project smoothly. So it's difficult to bring those designers at the first stage because they are actually trying to make the results. So in reality, maybe the designers should go back to the first stage, even though it's not their task. Maybe you can just take a look at how others are dealing with the process, and if there's anything that they can do or join, like a glancing at those, or like a kind of paying some interest in those extra task process. Well, by doing so, you can actually have additional interest in other projects, and you will build your ability to extend your the work scope. So you have to be curious. Everything starts from curiosity. Unless you don't have any curiosity, you cannot like go forward. So you have to make an experience, and by accumulating the experience, then you can be an expert. Actually, it's kind of difficult, and you might be afraid to take the first step. But I think if you are interested in every single aspect, I think better ideas will come out. Well, the glancing at several things. Well, I think it's a very interesting concept. What kind of results do we have, or what kind of process should I join? Rather than asking those, maybe you can just take a look at all those processes, each step, and if you have any chance to join, then maybe you can do it. I think that's a very interesting word. And next speaker is Choi-Ju-won. You are actually a student, college student. So what kind of the attitude do you have, and what's your stance? Can you share that with us?
여기 계신
Actually, I don't have much experience compared to those of the panelists here that when I do designs during the classes in school or for the service development, what I do is, or what I think about is, in that process, is actually obsession on the detail. In the process of detail, I'm obsessed with the details. I think that by this obsession is linked to be content of the outcome that you're going to drafting, or not be stalled by the fact that, oh, I'm satisfied with this. But this is rather than putting more efforts to change even the minimal things. So likewise, in the answer of Juno Shim CEO's answer, that in order to make this design, just because I understand the technology, it doesn't bring a great changes, because I know the technology, my knowledge in this technology may have bring some effect or influence in the design. And if I have an open-minded approach, perspective on embracing the other industries and sectors, I think that may be helpful. Thank you for your answer. I think this is actually a very helpful advice. As for designer, for the users, we should try our best efforts. Those efforts may not be visible at the moment, but in the future may bring great satisfaction to the consumers and the users. Now, I would like to also ask the same question to Professor So as well. So if you think about it, actually, I'm not a design manager, and I was actually raised for this question. So what capabilities are required by a designer? And I believe in that sense, there are two capabilities that is required. One is to identify the issue, and also to take a creative approach, which I spoke about at the end of my presentation. But I believe that this is a capability that the designer is actually really good at and they can do well. And I think the other factor, which is to identify and define the problem, is what is insufficient. So if you really can emphasize with what the issue of the users is, then you need to think about the definition of it, what has been identified. And because that issue has been identified, it'll be easier for you to come up with the resolutions. And here I want to raise the keyword, or give my keyword as a sponge. So actually, for the designers and the engineers, these people that I run into who draft the strategies, what I see in them is that they have a very strong ego. Of course, with the collaboration work, that your ego is required or respected, but in order for you to really understand what are the needs of your clients, you need to become a sponge. You need to understand what they're looking for, what they're asking for, and by doing so, I think this will be helpful in finding the resolution of the social issues as well. I believe that regarding the social problem resolution, that it was also mentioned during the IBM's director's speech, that the urgency, that our approach to deal with the urgencies, that is critical. And designer actually was in the past thought to be part of one process, but now they need to be part of a greater process in multifaceted environment, which would be a critical factor. In this regard, I believe that I agree with you. And I think this could be would bring a new perspective to you as a director in the policy decision-making department. And in this public service, I think there are occupations that require design or the designer's capabilities. Can you give an answer regarding on that? I think one of the keywords that has been raised today is empathy, the definition of problem solving, and user-oriented. These keywords were raised today, and as a team who plans for designs, what we do is to provide solutions to the users to satisfy their needs, or trying to seek for solutions that would be helpful. I think that we see what we know, so when we tried to identify and to find the solutions for the previous or past questions, it also had the limits to be faced and stopped by our experiences, and based on that, we were unable to find the answers by the users on the field who would require different things. And here, what I thought with all the advices that you have given, all the speakers have given, that in order for us to have a very successful process, we need a comprehensive thinking. We should not focus on just one sector, but also the design can be the architecture or the welfare or the aesthetics of it. We need to think about the multifaceted or multi-dimensions of design. And we should scrutinize and also listen to those advices from various sectors and reflect that into our design as well. Thank you for your answer. And I believe that our speakers have given us a very meaningful keyword, adaptivity to change, and for kind of glancing in the changes, in the new changes, and something attention and detail that we should not miss out as a designer, and sponge, playing the role of sponge to be communicating and listening to the people or the consumers, and lastly a comprehensive perspective. And I believe that these are the keywords kind of connecting all the stories that was shared by the speakers. I would like to add one more in this. What is important in this COVID-19? I believe what links is that is a new mindset of creativity, common creativity for connectivity and the network. I think we need connections for new ways of thinking. And during the keynote speech, we heard that to bring the outcome of the COVID-19 challenges, that we had to overcome 17 time zones in multiple nations. And I thought that these were the efforts in this perspective that we could do. And regarding the social problem resolution design, that we should think about this design as its social connectivity that we need to think about and take home to think about. Thank you for participating with us today with your valuable feedbacks. Thank you all, and thank you for those of you who have presented today as well. Now I will conclude the second day of 2020 Seoul International Forum. Thank you, moderator Yuri Koo, professor, and for all the speakers who have been with us throughout the sessions and also giving us great answers during the panel discussion as well. And those participants who have connected via online, thank you for your encouragement and participation. Design for social resilience in the post-COVID. I believe that city design stories were spoken about in today's sessions. This is a conclusion, and I believe it was a meaningful time that we took to turn the crisis into an opportunity. The forum began, the first day of forum was yesterday regarding universal design, and today we spoke about social problem solution design, and I would believe that it was an opportunity for us to convene and really discuss about these universal design. Thank you for being with us today, and I hope that you'll be able to share your vision with the Seoul Metropolitan Government. Once the video is finished, there's going to be a QR code which has a survey regarding this international forum. Please participate in this survey and complete the survey, and we're going to have a lucky draw of the participants to give you prizes. Thank you for being with us, 2020 Seoul Design International Forum. My name is Hannah Kim, who's been throughout the day. Thank you.